Matters of privilege and recognition of guests, the Honourable Premier.
Well, good afternoon, Mr. Speaker. It's good to be back for another day of debate in the Legislative Assembly. I don't have a whole lot today. I had a busy evening and a busy morning, so I didn't have a whole lot of time to thumb through the papers and websites to get all of the great comings and goings of PEI, but I do want to make a special recognition and greeting to Norman Clough and the staff at Clough's Red and White in the heart of District 15. I stopped there each morning for a coffee. It was nice to see Norman busy at work. His mother Verna, who was a former owner of the store, who was still partaking a little bit. She delivers the fresh bread and pastries in the morning, so I had a good chat with Verna, and just a great locale for all things needed in that area, and it's kind of the heartbeat of the community for all of us in that area, so hi to them. I was also encouraged to hear, Mr. Speaker, that a number of golf courses are going to open later this week, and it does seem very early for golf in many regards, but I mean, my backyard is really, really wet and muddy, Mr. Speaker, but apparently some of the golf courses are in really good shape. In particular, Avondale Golf Course, Belfast Highland Greens, and I believe Anderson's Creek are going to open later this week, which is really, really exciting. And last year, golf had a great boost and lift, and it seems like it's going to continue this year. So I hope for those who get a chance to partake, I'm more of a fair weather golfer, if at all. So I probably won't do any early season golfing, Mr. Speaker, but those who have gotten to tee time, I hope you hit them long and straight. I also want to say, Mr. Speaker, that our caucus had a great opportunity before the legislature opened here to have meet with some of the senior staff in the Office of the Child and Youth Advocate, Mr. Speaker, and it was really great to get an update from Marvin Bernstein and Ronna Smith as to how they have built that office, Mr. Speaker, in the last number of months. And I think it was, I was thinking there as I was listening to the presentation that there's much we disagree on in here, Mr. Speaker, when it comes to policies and issues. But I think one thing we can all agree on and can be very, very proud of as a legislature is that we all work together to get that office operational, Mr. Speaker. So it was great to hear, and thanks to everyone for doing that. And finally, Mr. Speaker, very happy to hear PEI Space Camp Productions, Mr. Speaker, winners of a $25,000 in a pitch campaign they made. Donnell Richard and Jake Sharon, with their new business, Mr. Speaker, took the award at this year's Francophone Ignition Contest in Abram Village, up in the heart of the district, represented by the leader of the third party, Mr. Speaker. It's a new bilingual mobile sound recording company. They've worked with such wonderful acts like Vish 10, the East Pointers, even the Wiggles, Mr. Speaker, from Australia. That might be a little old for you, Mr. Speaker, but for many of us who've had kids in the last 12 years or so, the Wiggles are burned into our brain, I think, Mr. Speaker, in some of their wonderful songs. But amazing news and amazing talent on PEI, and just very, very happy for Donnell and Jake for this wonderful award, and look forward to the great work they'll do in the future. So thank you very much, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thanks, Mr. Speaker. I'm just happy that the Wiggles is now in Hansard forever. Firstly, on a more serious note, I want to pass on behalf of our caucus the condolences to the Minister of Fisheries and Communities on the passing of his wife's Debbie's father, your father-in-law, David Wedge. So our thoughts are with you, Minister. This is, again, on a serious note, this is the third annual Green Shirt Day, a day where we commemorate the passing of that tragedy, the Humboldt Broncos, which, you know, was an unspeakable thing. But one of the beautiful things that emerged from that is this recognition that this is a great way of highlighting organ donation. And Green Shirt Day has been in place each year since that tragedy to remind us all about the importance of organ donation. One of the hockey players on the team who sadly died, Logan Boulet, his legacy has been the creation of this Green Shirt Day, and proud to wear a green shirt, as I often do in this legislature anyway, but particularly on this day in remembrance of the team, and also to remind all Islanders of the importance of organ donation. Bluefield High School is where all my kids went, and the carpentry students there have been using their skills to great effect. They've made picnic tables and something I'd never heard of, Gaga ball pits, which, you know, I'm again glad it's in Hansard now, but it's, as far as I can tell, it's a sort of gentler, kinder version of dodgeball, where you put as many kids as you can in this octagonal thing, and they throw balls at each other, softballs at each other, and it sounds like a lot of fun. Apparently, it's a big game, Mr. Speaker. Yeah. Anyway, thanks to the kids at Bluefield High School who are making these pits for Gulf Shore Consolidated, supporting one of the feeder schools for Bluefield High, of course, and so great work that they're doing there. And finally, I want to pass on my congratulations to Samantha McLean, who was recently announced as the UPEI Student Union President-elect for 2021-22 academic year. And she seems to be very well prepared for that challenge. In the new academic year, of course, UPEI is going to slowly transition back to normal classes and they're going to provide a blended delivery. And as Samantha said, she's ready to expect the unexpected and is looking forward to this exciting new year. So congratulations to you, Samantha, and I hope you do indeed have a great year. Thank you, Mr. Speaker.
The Leader of the Third Party.
Thank you, Mr. Speaker. And I, too, on behalf of my caucus, would like to express our sympathy to the honourable member from across and his wife on the passing of her dad. Our deepest sympathy. Mr. Speaker, I'd like to say hello to all the residents of Evangeline Musquesh, and I hope they have a good day. I don't think we're going to see much sun today, but I guess it's coming out tomorrow. So the weatherman says. Also, I'd like to kind of make mention about the Green Shirt Day. You know, it was a tragedy, but sometimes wonderful things come out of tragedies, and you know, for Logan to donate these organs saved a lot of lives, and it's a day that we must remember going forward. Mr. Speaker, also, you know, today is a day that, you know, we all should be thankful, and you know, sometimes we don't think about how fortunate we are, and to all be healthy and to be in here and working on behalf of Islanders is a wonderful privilege, and hopefully we can all continue to do that for a long time. Thank you, Mr. Speaker.
The Honourable Minister of Fisheries and Communities.
Well, thank you, Mr. Speaker. I'd like to take a moment and thank everybody in the House and all Islanders for all the calls and the messages and texts that our family received. On behalf of Rosie, David Wedge's wife, thank you very much, especially from Debbie. The amount of outpouring guests or support that we received over the last 5 days was tremendous. So, thank you.
The Honourable Member from Charlottetown West Royalty.
Oh, thank you, Mr. Speaker. It's a pleasure to rise. Say hello to everybody in District 14 today on this nice, beautiful day. And I want to just rise again and lend my support to Green Shirt Day. This is about as green a shirt as I had at the moment. So anyway, I'm wearing it with a lot of pride today. I think it's I mean, you have to look pretty close, but there's green tinges in there. But it's an important day today, and you know, a lot of attention has been brought to human organ and tissue donations, and you know, there's 11 Islanders that are waiting for transplants at the moment. The latest stats would suggest, and it's a great privilege for me to, during table of documents, I'm going to table today the first consultation draft on the Human Organ and Tissue Donation Act that I've been working on, just to let Islanders know and let everybody see it. And I think it's very fitting today. So thank you very much, Mr. Speaker.
Honourable Member from Summerside South Drive? No? The Honourable Member from Cornwall Meadowbanks and Third Party House Leader.
Thank you, Mr. Speaker. Mr. Speaker, this morning I had the opportunity to visit an old alma mater, Elliott River School in Cornwall, and they were doing a virtual assembly, and it was for Earth Month, and they're participating in a fundraiser, but first of all, it's a contest of providing or getting old batteries. So it's a battery blitz for your old batteries, and the theme basically surrounds Earth Month, and it's put on by Earth Rangers, which is an Ontario company that does this across the country, and all the elementary schools, I think, of PEI are participating. And pretty amazing to see, you know, the virtual assembly and how they connect with kids. And it's their response basically is to ensure that we preserve wildlife as much as possible and stop the litter. So I was a part of that this morning, and I was outside the school doing it, and I can hear the kids inside the school, so it was great. And on the organ donation, Mr. Speaker, I don't have a green shirt, and we made him take off his dark green one and put on his light green one. But, you know, it's such an important issue, and it makes you think, when that accident happened, and I know my son played hockey at a relatively high level, and traveling across the country on buses around Atlantic Canada, through Ontario, and you never think of those situations until something like that tragic happens, and for what those people have gone through. But as our leader says, you know, some good things can come out of some tragedies, so hopefully it continues. So thank you, Mr. Speaker.
Done. Honorable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. It's a pleasure to rise again, and hello to all of constituents of District 4. A beautiful day, very foggy drive in this morning, Mr. Speaker, but good to see some traps on the wharf and people working at their traps. I just want to mention that the Eastern PEI Chamber of Commerce and the West Prince Chamber of Commerce have partnered in a rural PEI workforce survey, Mr. Speaker, and it's through the Labour Market Development Partnership, and I encourage everyone to reach out to their constituents to fill out that survey. I think it's very important to get that feedback from rural communities and rural businesses. So I'm sure if you check out either the West Prince Chamber or the Eastern PEI Chamber of Commerce, you can find that survey. Hope everyone has a great day. Thank you, Mr. Speaker.
Did I miss anyone? No? Member statements? For first statement, I'll call on Charlottetown, West Oregon.
Thank you, Mr. Speaker. Yesterday, I rose during question period to ask the Minister of Education questions regarding ventilation systems in 10 Island schools. However, all I received in response was repeated questionable assertions that ventilation quality has nothing to do with the potential spread of COVID-19. Mr. Speaker, this issue existed before COVID-19, and it will continue to exist after COVID-19. Regardless of the pandemic, we still have 10 Island schools needing to open their windows in all weather conditions simply to obtain access to clean air. This is more an issue of aging and neglected government infrastructure than it is the issue of COVID-19. Like many other issues, COVID has had an urgent and to address the problem. However, it appears this government still has no urgency to update the air ventilation system in these 10 Island schools. Even when the pandemic passes, we will still have island students exposing themselves to outdoor weather conditions just to obtain clean breathing air. I asked the minister yesterday if she felt this was an acceptable situation, but I am yet to receive an answer. I must say, it was concerning to me that the minister appeared to give a political answer, seeking to avoid responsibility instead of acknowledging the issue and committing to address it. We know this issue won't be solved overnight, likely not even in a year, but Islanders do expect from their government is that they at least try to address the problem at hand. Even if you don't replace all 10 school systems now, make a plan and start somewhere. Regardless of COVID-19, it's the government's responsibility to ensure public buildings have quality air ventilation systems. As it stands, we have 10 island schools that are not giving the right to clean air. I would encourage the minister to look into this issue and develop a plan to get some, and eventually all, of the 10 schools in question the air ventilation systems they need and deserve. Thank you, Mr. Speaker.
The honourable member from Charlottetown,
Start Monty.
Meadowbanks, and the third-party house leader.
Thank you, Mr. Speaker.
Cornwall.
There are certain fundamental principles we follow in this House, and among the most important is our individual and collective respect for democratic debate. It is crucible of the public debate that nurtures our democracy because ideas and concepts are tested, examined, approved, or rejected. In the end, Mr. Speaker, we tend to get it right because we apply stringent tests to our decision-making process. What worries me, Mr. Speaker, is the obvious desire of certain opposition members to assume a cloak of moral superiority and judgment when it comes to debate. Let me put it bluntly. Mr. Speaker, a position taken by one individual or party dictates neither higher morality nor an enhanced perspective on what is right for our society. During this sitting, a member has promoted the goal of lowering the voting age. Fair enough, Mr. Speaker. That is a great and worthy topic. I have learned a lot about the subject over the course of the debate. In the end, I may support the proposal because there are valid reasons to do so. But Mr. Speaker, I've also heard persuasive arguments against lowering the voting age. And as a public representative, it is my duty to weigh both sides and stand by my position when it comes time to vote. Such matters should not permit the luxury or laziness of abstention. And when my decision is made, I will be prepared to defend it in public. So yesterday I was quite bothered by the following statement made in support of this proposal, and I quote, "It is our job as legislators to uphold our democracy, to strengthen it and expand it. If we aren't up to the task, perhaps we should reconsider our place in this House." Mr. Speaker, that statement's not about democracy. Rather, that statement reflects a kind of moral dictatorship that seeks to smother debate and discussion in favor of an authoritarian impulse that allows no disagreement. And even if I vote no on this proposal, I believe I still have the right to remain in this House and serve my constituents to the best of my abilities. Furthermore, I will not be dictated to, and I would urge all members to consider their roles as public representatives who truly value public debate as an exercise that preserves and enhances our democracy. Thank you, Mr. Speaker.
The honourable member from Summerside South Drive.
Thank you, Mr. Speaker. Mr. Speaker, over the last several weeks, I've been contacted by islanders who are devastated by the ban on flavours after using flavoured vaping to quit smoking. I would like to share a story of one of the many islanders who reached out to me since I asked questions in the legislature. Quote, "Hey Steve, my mother, who is 65, has smoked cigarettes for 40 years and was able to quit cigarettes 4 years ago by vaping and has since almost reduced her nicotine concentration to 0. I agree with the age increase, but not the ban on flavored vape products altogether. I fear it will basically force my mother and many others in a similar situation to her back to cigarettes," end quote. That was from Chelsea Pallone. We need to recognize when harm is being caused to islanders and work to ensure policy encourages harm reduction. This was my primary concern when the legislation was presented to me for consultation, and I was reassured that it would not be a ban on flavors. I implore government to reconsider its flavor ban and put the well-being of islanders at the forefront. Harm reduction means acknowledging that the use of addictive substances is occurring and that some methods of consumption are more harmful than others. For instance, we all agree that safe consumption sites for injection are a harm reduction tool that the province should be providing. Why then are we taking away a valuable tool in harm reduction for tobacco smokers? Ironically, the only flavor that is still permitted is the one most closely tied to smoking, tobacco flavor. Tobacco smoking kills half its users, according to the World Health Organization. Reducing harm in light of these statistics should be at the forefront of government policy. The flavor regulations need to change, and the lens of harm reduction and islanders' well-being needs to be at the forefront. Thank you, Mr. Speaker.
Questions by members, starting with response to questions, taking as notice. The Honourable Minister of Education and Lifelong Learning, Minister responsible for the status of women.
Thank you, Mr. Speaker. Yesterday, the member from Charlottetown Victoria Park asked about the consultation process used by the Autism Coordination Committee. Consultation with community partners such as the Autism Society of PEI, Stars for Life, and the Association of Community Living, as well as with families, is something we take very seriously in developing our policies and programs. For instance, in the introduction of social ABCs, we made sure to consult a number of parents with young children who are awaiting diagnosis, as well as those who received diagnosis and were in IBI or the school system. That consultation continues as the province gets ready to launch the program. I would also like to add that the inclusion of music and equine therapy for school-aged autism funding is a direct result of what government has heard from stakeholders. I agree with the member that these voices are important and necessary contributions to implementing programs and policies that will support them, and these voices will continue to be included. As part of our Autism Coordination Committee, subcommittees have been developed, and that includes stakeholders. As for making public the meeting minutes of the Autism Coordinating Committee, it is certainly something we can look into as we develop the autism webpage. And if I may, Mr. Speaker, I also committed to the member of Cornwall Meadowbank to bring back information on the pre-kindergarten consultation process. I will table the full list of stakeholders participation, but as an example, it included Lennox Island First Nations, Abequid First Nations, our province's education authorities and post-secondary institutions, the Office of the Child and Youth Advocate, and our early childhood center owners and operators. Virtual town halls took place on March 23rd and 24th for early childhood educators and March 30th and 31st for parents. In total, 105 early childhood educators and 109 parents signed up for the consultations. There is most certainly still some time to participate in the consultation process. We have an online survey and are accepting written responses until April 9th, 2021. As of yesterday, we have received 167 online responses. Mr. Speaker, additionally, we will include the child's voice in the consultation process, as our early years advisor will speak directly with children at centres to find out what they find fun about pre-kindergarten. Mr. Speaker, we also reached out to both the opposition parties to schedule consultations. I do want to thank the member from Charlottetown Victoria Park for attending and asking thoughtful questions and providing good feedback that can be considered, so thank you. Our department reached out to the member from Cornwall Meadowbank on 3 occasions, so on February 24th, March 5th, and March 10th, to coordinate participation in the consultation. That invitation is still without response. If the member would like to set up a suitable time to participate in the consultation process, we would most certainly be happy to accommodate. Thank you very much, Mr. Speaker.
No one else? No? For our first question, I'll call on the Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. A few weeks ago, the Minister of Justice and Public Safety announced that the province would be doing a midway point review of the 2017 police review. The government's backgrounder on the police review says, and I quote, "A series of committees was struck to develop a work plan to consider the review recommendations and commence action to implement prioritised recommendations," unquote. However, there appeared to be no indication of public representation on any of those committees that are doing the work. A question to the Attorney General. When public trust and confidence is essential to the effective delivery of police services, why is there no indication of public representation on any of these committees?
Minister of Justice, Public Safety, and the Attorney General.
Thank you, Mr. Speaker, and that's a valid question, Mr. Speaker, and we're setting up new committees every day. And with this police review, Mr. Speaker, it's designed on the basis of recommendations, Mr. Speaker, from these committees, Mr. Speaker, because we're looking at a new way of policing, Mr. Speaker. Times have changed, Mr. Speaker. Community well-being has to be a focus, Mr. Speaker, and I'm hoping the police review will bring recommendations, Mr. Speaker, that are moving with the times. Thank you, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thank you. Community well-being, of course, has to be central to the work of the police, and that community is made up of citizens. And I'm still surprised that the Minister didn't respond in any way to reassure me that the public will actually be involved in these committees. I hope that's not the case. The province released a survey to collect the public's feedback on the police services being offered in their community. In one part of the survey, it asks whether police are doing a good job developing relationships with youth, with seniors, and people of diverse backgrounds. However, there are no demographics attached to those questions, making it impossible to determine whether the feedback is actually coming from those affected communities. A question to the Minister. What are you doing to address this glaring error in the consultation process?
Minister of Justice, Public Safety, and Attorney General.
Well, thank you, Mr. Speaker, and thank you for pointing that out, Mr. Speaker. I'll take that back under advisement, and we'll see if we can address that survey, Mr. Speaker, that question in the survey. And the member is right. We have to include all diversities, and we have to know where the answers are coming from. Thank you, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thanks, Mr. Speaker. Prince Edward Island currently has one of the most restrictive police complaints process in the whole country. Islanders only have 6 months to file a police complaint, and with a few narrow exceptions, only those who are directly affected by police misconduct can actually file a complaint. These restrictions lag behind the best practices across the rest of the country, which allow generally for a 12-month complaints window, and when it's deemed to be in the public interest, the ability to hear complaints outside of that window, and also to allow people that are the witnesses of police misconduct to file a complaint, something they cannot do here on PEI. Question to the Attorney General. Do you agree that the complaints process, police complaints process here on PEI is outdated and needs to be updated?
The Honorable Minister of Public Safety, Attorney General.
Thank you, Mr. Speaker. And as we move forward, we're trying to update everything, Mr. Speaker, to make sure we're inclusive, Mr. Speaker, and make sure the proper aspects are taken, Mr. Speaker. And so with this, I'll bring back, and we always room for improvement, Mr. Speaker, and we want to move forward. And it's about the services and the community well-being, Mr. Speaker. That is a focus of our department, community well-being, and we will look at that. Thank you, Mr. Speaker.
The Honorable Leader of the Official Opposition.
Thanks, Speaker. There's been a lot of discussion recently, of course, about police with respect to mental health. And in the continued absence of the mobile mental health teams, police officers are currently still responding to all mental health calls. One of the police review recommendations was to create guidelines regarding criminal record checks. A few years ago, Ontario introduced the Police Record Checks Reform Act, which, among other things, created restrictions about sharing information that was collected during non-criminal contact with police, such as during a response to a call for a person suffering from a mental health crisis. A question to the Minister of Justice. What laws or regulations are in place to protect islanders against the disclosure of non-criminal information collected during record checks, and in particular, information relating to mental health incidents?
The Honorable Minister of Justice, Public Safety, Attorney General.
Thank you, Mr. Speaker, and that's a very important question that I'll bring back, Mr. Speaker, but when we talk about mental health and police officers, I have to say that, you know, with the mobile mental health unit coming soon, Mr. Speaker, every officer is getting extra training on mental health, Mr. Speaker, mental health awareness, and being when they go to just the way they deal with it going forward, Mr. Speaker. So I look forward to that, and a lot of officers have already taken that. So, Mr. Speaker, it's very important, and I'll bring that the question back. Thank you, Mr. Speaker.
The Honorable Leader of the Official Opposition.
Thanks, Mr. Speaker. The position of Police Commissioner is currently still vacant, and it's being filled on an acting basis by the Deputy Police Commissioner. A question to the Minister of Justice. When does government intend to fill the vacant position of Police Commissioner?
The Honorable Minister of Justice, Public Safety, Attorney General.
Well, thank you, Mr. Speaker. We are actively trying to fill that position right now. Thank you, Mr. Speaker.
The Honorable Member from Tyne Valley, Sherbrooke.
Thank you, Mr. Speaker. Last week, I asked the Minister of Health if he would be privatizing any other healthcare services, to which he did not provide a clear answer. However, I have learned that cytology laboratory services are in the process of being privatized already, with all services soon to be outsourced to Ontario by 2022. Privatizing healthcare services to an off-island company will not only result in job losses here on PEI, but will also be a loss of control over the timing and quality of a critical and essential service. Question to the Minister of Health: why have you decided to privatize this essential healthcare service?
Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker. And the honourable member references with regard to privatization. I am sure, Mr. Speaker, that she is referring to the great debate, the great discussion that we have had here in this legislature with regard to the mobile response units, which I stated, Mr. Speaker, unequivocally that it is not a privatization with regard to mobile response units. I'll be honest, Mr. Speaker, I do appreciate the member bringing this forward to me. I will have to look into it further, and I will endeavor to report back to the legislature on this matter as soon as possible. Thank you, Mr. Speaker.
The Honourable Member from Tyne Valley, Sherbrooke.
Thank you, Mr. Speaker. And of course, issues of privatization of healthcare services are important across the board, but today I'm speaking specifically about the cytology lab. The cytology lab plays a key role, Mr. Speaker, in detecting several cancers, precancerous changes, and other conditions. Losing the cytology lab here means that we would lose the ability for same-day, short turnaround results for emergency situations. Question to the Minister of Health: are you okay with that?
Honourable Minister of Health and Wellness.
Well, Mr. Speaker, again, thank the member for the question. At the end of the day, every program that we provide, every service that we do provide across every government department, but certainly within the Department of Health and Wellness, who has to be at the front of the decisions and of the programs? It has to be about Islanders. As I had stated, though, Mr. Speaker, in my response, in my answer to the honourable member's previous question, I certainly do appreciate the member bringing it forward. I will look into it further and bring information back to the legislature. But again, Mr. Speaker, I have to reiterate that every program at the focus has to be about Islanders. Thank you, Mr. Speaker.
Tyne Valley Sherbrooke.
Mr. Speaker, I have to note that so far we've not gotten any conclusive response here about what's happening with the cytology lab. I'm getting a little concerned that the minister might not actually be aware of what's happening with this lab. I want to highlight that PAP tests make up a majority of the tests the work that is done in the cytology lab. There are concerns that PEI plans to reduce the frequency of PAP screenings, which would be against recommendations from the Canadian Cancer Society and other experts. I will also note that this would be something that would likely be found in a women's health strategy if PEI actually had one. Question to the Minister of Health. Reducing the frequency of PAP testing would be out of step with every other province in Canada and against expert recommendations. Will this government be putting women's health at risk by reducing the recommended frequency of PAP testing on PEI?
The Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker. And I don't have to keep coming back, or I shouldn't have to keep coming back and indicating to the member that I do appreciate her bringing it forward and that I will be bringing information back. The member, though, in her last statement refers to the women's health strategy. Oh, Mr. Speaker, the department is actively working on a women's health strategy, and that will be released in the fall of 2021, Mr. Speaker. Thank you very much.
Tyne Valley Sherbrooke.
Thank you, Mr. Speaker. I appreciate that the Minister of Health appreciates my questions. I have a few more, so be prepared to continue to appreciate. In fact, during a recent pilot at the cytology lab that saw some tests being sent off island, several tests were damaged in transit. They were lost or even frozen in some cases, effectively destroying the sample. It can take weeks or even months to get test results in this way. Imagine, Mr. Speaker, being a woman who has a PAP test where the physician finds something suspicious but has no way of fast-tracking the results, leaving that woman waiting for a month under that kind of stress. Question to the Minister of Health, does that seem reasonable to you?
The Honourable Minister of Health and Wellness.
Well, Mr. Speaker, again, I have to say that, we have to provide the best quality of service that we can for all Islanders. The issues that the member has raised, and I'm not going to apologize to the member for stating that I want to work with her, but I appreciate her bringing these issues forward because we do, whether it's with regard to debate, whether it's with regard to reaching out, with regard to suggestions for improved services, Mr. Speaker. I think everybody on this side of the House is more than happy, more than willing to work with members in the official opposition, with members in the third party, Mr. Speaker. And again, Mr. Speaker, to her question, to the honourable member's question, we have to provide the best quality, the safest services to all Islanders that we possibly can. Thank you, Mr. Speaker.
Tyne Valley Sherbrooke.
Thank you, Mr. Speaker. And preventing the privatization of healthcare services is not simply a suggestion. It is absolutely something we need to be aware of, and the minister should be aware of. We should not be privatizing healthcare services. Mr. Speaker, we also have to look at this through the lens of recruitment and retention of doctors and healthcare professionals. If we privatize this service, PEI will be the only province in Canada without a cytology lab. Question to the Minister of Health. Why would healthcare professionals, such as oncologists, choose to practice in a province without access to basic diagnostic services, where they might need to wait for up to a month for tests to results that they could get in a day in any other province? Why would they do that?
The Honourable Minister of Health and Wellness.
Well, Mr. Speaker, I'm really happy that the honourable member brings up the issue with regard to recruitment, with regard to retention. We look at the budget that was recently tabled, and the honourable member, certainly all of the members in this legislature will be receiving additional details when the budget is brought forward. But what have we incorporated into that budget with regard to primary health care stabilization? $4.11 million. What have we initiated through the budget with regard to nursing recruitment? An additional $1 million. With regard to nursing retention, an additional $500,000. Mr. Speaker, we have programs. We increased the nursing incentive for new graduates from 1,100 to 5,000, Mr. Speaker, and that, Mr. Speaker, is showing results. And when I say showing results, the information that I've received, Mr. Speaker, if I could just there have been graduates this year have accepted 50 positions, nursing positions, new graduates on PEI. Thank you, Mr. Speaker.
Tyne Valley Sherbrooke.
Thank you, Mr. Speaker. So getting back to the topic of cytology lab, having absolutely no cytology lab capacity in the province would put us in a very vulnerable position, Mr. Speaker, as any private company will quickly realize that we are at their mercy, essentially forced to pay any price for a service that we have willingly given up the capacity to provide for ourselves. Question to the Minister of Health. The cytology lab has a small number of staff and is inexpensive to maintain, but rebuilding this capacity would be very difficult. It would be very likely that it would be gone for good. Have you considered the long-term impacts of privatizing this service?
The Honourable Minister of Health and Wellness.
Well, Mr. Speaker, there's two issues that I want to address here. First of all, in the member's previous question, she brought up with regard to recruitment, and I was happy to provide information on just the initiatives, the great initiatives that we've taken. In a number of your questions, so that she has brought forward this afternoon, Mr. Speaker, she has referred over and over again to privatization. And Mr. Speaker, let me be perfectly clear that this government is not privatizing the delivery of health care services, Mr. Speaker. Thank you.
Tyne Valley Sherbrooke.
Mr. Speaker, all of the information I've shared today about the cytology lab could have been learned by the minister if he had simply consulted with the lab tech workers and their union. Again, Mr. Speaker, we know this consultation did not happen, just like it didn't happen when management of the mobile crisis units was also privatized, or maybe it wasn't and maybe it was, who knows. There was a lot of confusion there, Mr. Speaker. I fear this is yet another example of unions and workers being completely left out. Question to the Minister of Health. How can Islanders, especially women, trust that you're making evidence-based decisions in the best interest of their health when you consistently don't consult stakeholders and you have no strategy?
The Honourable Minister of Health and Wellness.
Well, Mr. Speaker, first of all, with regard to consultation, I have met with the board, as I have mentioned before, of Health PEI. I have met with the unions. I had a great meeting this morning with regard to advocates on diabetes programs, Mr. Speaker. Unfortunately, as much as I'd love to, there's a large number of employees within Health and Wellness and Health PEI. I'd love to have the opportunity to meet with each of them individually. Unfortunately, that just can't happen. But, Mr. Speaker, the member refers again to women's initiatives. We have the Women's Wellness Program. We have the Dense Breast Information and Screening Program. We are actively working on the midwifery program, Mr. Speaker. And as I had referred to earlier, Mr. Speaker, that the women's health strategy is actively being worked on and will be released in the fall of 2021. Thank you, Mr. Speaker.
The Honourable Member from Summerside, Wilmot.
Thank you, Mr. Speaker. We all know what happened with the Dunk River last summer. People are worried that with all the holding ponds in the area now, we're heading for a repeat this summer. The Water Act is being touted as the thing that will prevent this kind of reckless decision-making in the future. But if the Premier and his ministers ignore the rules that exist now, I don't see how new rules for them to ignore will help. Question to the Minister of Environment. Help me understand how the Water Act is supposed to stop government from making bad environmental decisions.
The Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So it's good to get up and talk about the farmers over in the Dunk River who suffered drought conditions last year. I know they're being vilified and I feel bad for them. But the truth of the matter is we're in a period of climate change. The climate is changing. We have to make adaptations. And some of those adaptations might have to be in water. We have an act now that will protect any adaptation that we might bring forward so that the water table will stay at a safe level for all islanders. And I think that's important. I think we're the only province in the country to have it. And I think that our islanders should rest easy knowing that their water is protected while we address climate change in this province. Thank you, Mr. Speaker.
Summerside Wilmot.
Thank you, Mr. Speaker. I think it's clear Islanders will not rest easier with that answer. There's absolutely no part of this that has explained how the Water Act is going to better protect Islanders. Mr. Speaker, we have had 3 people hold this portfolio, but I'm not convinced we've ever actually had an environment minister. Someone who championed this file instead of treating it like some kind of support department that exists to benefit other files. We need someone to champion the environment instead of someone who tells us why they are prioritizing something else. Those other things already have ministers. Question to the Minister of Environment. When it comes to protecting our water, which will you focus on, the environment or the economy?
The Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So we, as we've pointed out, I think several times, we plan on protecting the environment, moving forward towards net zero while building an economy around it. And I think that the economy and the environment are interconnected. And if you listen to any jurisdiction in the world that's tackling this problem right now, they're hoping to build an economy around their solutions. As far as what we were doing, because the honourable member over there doesn't want to talk about any of the good things, she never asked me about net zero, though it's the biggest file that a government has ever taken on in the environment in the history of Prince Edward Island. We have a buffer zone program that's going to help protect buffer zones so that we don't have pesticides run into the river, so that we don't have runoffs in the river, so that the health of our rivers go back to the way they were. No government has ever done that before. We've moved our land protection from 7% to 10% so that we can protect land, so we can sink carbon, so that we can protect the environment here in Prince Edward Island. We have a sustainable communities program here in Prince Edward Island that the honourable member has never asked me about. We're challenging communities to take this on themselves so they can tackle climate change and make money for their own community so they can have ball fields, churches, rinks in their own community. And finally, Mr. Speaker, we are building green tech right across this province, and not once have I heard from that party over there that they care about green tech in this province either. Thank you, Mr. Speaker.
The Honourable Member from Summerside Wilmot.
Thank you, Mr. Speaker. What a performance that was. I can't help but point out to the member, Mr. Speaker, that did not reference what he is going to do about the water in this area. Every jurisdiction in the world that is tackling this well is putting a focus on environment and has a minister who is prepared to say no to other departments. Question to the Minister of Environment. If the Dunk drops below safe levels this summer, will you say no?
The Honourable Minister of Environment, Energy and Climate Action.
Thank you, Mr. Speaker. So there's no way that this honourable member could be happy unless Cavendish Farms is closed. I don't know where the people who live in her district are going to work when that happens, but there's nowhere. No, this is what you want. This is all the leader of that party over there has ever been after, is to chase the Irvings out of this province. We believe in island farmers. My neighbours who are farmers are communities. They're 4th generation farmers. They've coached ball. They're involved in the church. They're involved in the community. They're good, upstanding citizens, and they care about the environment, Mr. Speaker, too, because you know what? You can do both. You can be a farmer and care about the environment. As far as what we're doing, thank you all. And as far as what we're doing to protect water here in Prince Edward Island, we've enacted the Act that's been in place since 2017, so we can finally protect water here in this province. We're going to work with all sectors who need water, including people who need to drink water, people who need to take water for communities such the size of Charlottetown, people who need water to grow crops in Prince Edward Island, and I'm not ashamed that we're going to make sure that there's water there for everybody, including those who choose to feed you. Thank you, Mr. Speaker.
The Honourable Member from Tignish Palmer Road.
Thank you. It's going to be hard to follow.
Mr. Speaker, government representatives have indicated before a legislative committee that agreements with Bell and Xplornet will see either a 95 or 97% of island households having access to the CRT broadband standards. Now, we all know that businesses and many islanders work from home have felt the struggle with spotty internet services, Mr. Speaker. Now, no one in my area is expecting a miracle, but they do need some assurance from this government that they will have universal access to reliable, high-speed internet. My question is to the minister responsible for access to high-speed internet. Why did you choose 95 to 97% as your connection target?
The Honourable Minister of Economic Growth, Tourism and Culture.
Thank you, Mr. Speaker, and thank you, Honourable Member, for the question. So certainly, our goal is to have 100% of all islanders with internet. What we've done realistically when the contracts come out, it covered between 95 and 97. And we've seen previous administrations promise everybody high-speed internet, and I want to be truthful. The last 5%, the last 3% is going to be a challenge. We're working on that now. There's a report coming from Stantec here in the next month that's going to show them gaps in the area, and we're going to make sure we get to that 100% eventually here, Mr. Speaker.
Tignish Palmer Road.
Thank you, Mr. Speaker. You know, I recognize that this is not a new problem. It's not a new issue on the island. But government has committed to their own targets. And I, like islanders, want an assurance. So question to the same minister. When do you expect 95% coverage, and what are you doing now to ensure that you hit your own targets?
The Honourable Minister of Economic Growth, Tourism and Culture.
Thank you, Mr. Speaker. So the agreements to the 95% targets will be completed by 2023. As of January, I don't have the updated numbers, but Bell has almost rolled out their end of the contract. I'm guessing we're in the vicinity of 11,000 to 12,000 hooked up now. As well, we've already taken initiatives to go out to the last 5%. So what we've done now, there's one project that has been approved, which will be rolled out shortly, and we're waiting on a final report from Stantec to show where all the gaps are across Prince Edward Island, and we're committed to hit them gaps as well by 2023.
Tignish Palmer Road, your second supplementary.
Thank you, Mr. Speaker. Mr. Speaker, can the same minister explain how they came to find out or how they're trying to identify those gaps? And can we have an assurance today that those gaps will also be filled at the same time the rest of the islanders have access?
Economic Growth, Tourism and Culture.
Thank you, Mr. Speaker. So we've hired a consultant to, I guess, look at the last so-called mile, as we call it, to find out where the gaps are. And the biggest challenge that we find across PEI, and it's all members in this district, in this chamber that are affected, hills, valleys, trees, that sort of thing. So we're reeling in to see exactly where them spots are at. We're getting more and more information as every week goes by, and we're preparing to roll that last bit out. So we're still waiting on that final report. Once I do have that final report, I'll table it in the House for all members to see, and then we're going to come up with our inter-strategic plan of where we're going and how it's going to be rolled out by what such and such a date. Thank you, Mr. Speaker.
Tignish Palmer Road.
Thank you, Mr. Speaker. The Access PEI location of Tignish is a one-stop shop for essential government services in my community. It is a very important hub. Residents are continually and constantly asking me, why is the site still not open full-time? Mr. Speaker, I asked the former minister on 2 different occasions last year in this House about this very matter. My most recent inquiry was in November, the end of November, and the minister at that time stated that Access PEI Tignish would be open in January. Well, Minister, it's now April. Or, Mr. Speaker, it's now April. Mr. Speaker, access to government services and programs should be equally accessible right across this province. The weekly closure is making it more difficult to access essential services, much like the spotty internet service we experience in the West. Why should we also suffer spotty access to government services? So my question is to the Minister of Transportation and Infrastructure. When will Access PEI in Tignish be open weekly as it was pre-pandemic?
Honourable Minister of Transportation and Infrastructure.
Thank you very much, Mr. Speaker. So, Mr. Speaker, obviously during the pandemic, we had to adjust our openings and our services. Mr. Speaker, there's been a tremendous amount of work done within the Office of Access PEI with regards to the best way to provide this service. And Mr. Speaker, one of the things that we're looking at is establishing a brand new service called Contact PEI. Our director is doing a lot of work on that right now. And Mr. Speaker, I anticipate that we'll be having an announcement very soon on the rollout of this new service. Thank you, Mr. Speaker.
Dinesh Pomeroy.
Thank you, Mr. Speaker. Residents have been extremely patient during this pandemic, and in particular, Mr. Speaker, our seniors. Many seniors in my area do not have access to a computer and need a little bit of in-person assistance. From now until late fall, fishers are busy, plant workers have limited time actually to access this site, and seniors may not have access to transportation. So, Minister, you just mentioned about some things that your department is doing I guess you have an announcement coming soon, but what are you doing to address the issues that are delaying the opening of the Access Centre in Tignish?
Honourable Minister of Transportation and Infrastructure.
Well, thank you very much, Mr. Speaker. So, Mr. Speaker, one of the things that we do is we look at the volumes at the various locations. And, Mr. Speaker, right now, by rotating 1 week between one community and the neighbouring community, we feel that we are providing that level of service. But, Mr. Speaker, certainly the sheer volume of online registrations for driver's licenses, for car registrations, has gone completely through the roof during this period of time. So, Mr. Speaker, we are there, we're providing the service, and as I said, once we're prepared to launch Contact PEI, I think the honourable member will be ecstatic over how the service looks. Thank you very much, Mr. Speaker.
Dinesh Pomeroy.
Thank you, Mr. Speaker. Well, Mr. Speaker, right now it's confusing to residents who don't know which week and what site is open. Or if it's even open at all. So, Mr. Speaker, the former minister has already committed in front of this entire legislature to continue to offer a physical access PI location in Tignish full time. So my final question is to the Minister of Transportation. Can you confirm a date for the residents of Tignish and area that the centre will have will reopen permanently full time?
Honourable Minister of Transportation and Infrastructure.
Thank you very much, Mr. Speaker. So to the honourable member, I would be more than pleased to bring that information back tomorrow and provide it to you. Thank you.
The Honourable Leader of the Third Party.
Thank you very much, Mr. Speaker. Mr. Speaker, a question to the Premier. Premier, yesterday you said, and I quote, if you're a seasonal resident in Canada who has a seasonal residence here on Prince Edward Island and you have proof of a vaccine, you can come here without needing to isolate. So, is the Premier suggesting some sort of COVID passport for people traveling to Prince Edward Island?
Honourable Premier.
Well, Mr. Speaker, that's not exactly what I said, but the premise is generally right. What we are working toward in partnership with the Chief Public Health Office, Mr. Speaker, is looking at what our summer looks like, just like we did this time last year. We worked last year to bring our seasonal residents into Prince Edward Island, particularly those, specifically those in Canada, to try to do it as safely as possible, and we did a wonderful job doing that. I think as we are in a state of public health emergency, we require anyone coming to Prince Edward Island to tell us that they're coming, and if they haven't isolated or if they haven't been vaccinated, or if they're coming here right now, they need to have an isolation plan and a number of things. We've been doing this for a year. So I think as we post our gaze forward, Mr. Speaker, what we would be asking people coming here, if they can demonstrate they have a proof of vaccine, that with 80% of island adult population being vaccinated and 80% of Canada being vaccinated, that there would be the hope that we don't have to have a 14-day isolation.
The Honourable Leader of the Third Party.
Mr. Speaker, the Premier also said the following. I think from a U.S. perspective, if the Canada-U.S. borders were to open, that would extend the same privilege to those seasonal residents from the U.S. who aren't able to come here last year with the proof of vaccine. So are you saying that all isolation requirements may be lifted even for international travel?
The Honourable Premier.
Once again, Mr. Speaker, that's not exactly what I was saying. Is right now there is no travel between the borders of Canada and the U.S. except for what is deemed as essential travel. So you can't, as a seasonal resident who owns property in PEI, you can't come here from the United States. I do anticipate that at some time this year, I don't know when, but that border is likely to open. And at that time, we would work with those seasonal residents from the United States who have a residence here to access their property, which they pay tax for, Mr. Speaker. So we would be staggering this, of course, kind of like we did last year. That would be the plan. But as I say, that we're casting our gaze to the summer, Mr. Speaker. There's a lot of information and data and research that we need to follow along the way. But what we've been talking about since we started the vaccination process in PEI and in the country is what travel looks like, Mr. Speaker, when we get to what we have been calling herd immunity.
Honourable Leader of the third party, or second supplementary.
Thank you, Mr. Speaker, and thank you, Premier. Premier, so what about islanders with vaccinations who travel away? If a year-round resident is vaccinated and goes to Toronto, let's say, for example, will they need to isolate when they return?
The Honourable Premier.
Well, Mr. Speaker, I think that is a great question, and I think we're working hard to get that answer to be no at some point soon, Mr. Speaker. As I say, there's a lot of research, there's a lot of data that we have to monitor and follow. I do say, though, that when we look at getting 80% of our adult population vaccinated, 80% of Canadians being vaccinated, there is an anticipation with that there will be a freer version of travel. But also, we will still be requiring things like masking and operational plans for accommodations in restaurants, etc. So life will change perhaps a little bit as we look toward the summer, but I still think a lot of the health protocols that we have in place will remain in place for some time. But it is my hope that the answer to that question at some point in the near future is yes.
Morel-Donagh.
Thank you, Mr. Speaker. Mr. Speaker, looking on the government website, I found a brochure called Health Careers on Prince Edward Island that profiles 60 career options in our island health system. The brochure profiles different jobs, their duties, the education required, and the salary ranges in the mental health and addictions field. Some of these jobs command a very good salary, Mr. Speaker. A question to the Minister of Health. As a province, we do targeted promotions and innovative partnerships to promote careers in fields like construction, bioscience, and nursing. What are we doing similarly around mental health careers?
The Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker, and excellent question from the member. Certainly, you look within the Department of Health and Wellness and within Health PEI, there are different ones who are actively working on an ongoing basis, Mr. Speaker, with regard to recruitment, not only, Mr. Speaker, with regard to mental health and addictions opportunities, but right across the board, Mr. Speaker, whether it's nursing, whether it's pharmacy, whether it is doctors, Mr. Speaker. And as the honourable member had indicated, the information that he obtained on the website. So that is just wonderful ways that we provide this information with regard to recruitment. Thank you, Mr. Speaker.
Morel-Donagh.
Thank you, Mr. Speaker. Mr. Speaker, my next question is to the Minister of Economic Growth. We look across North America and around the world at places hard hit by the COVID pandemic. No doubt there are people who work in the mental health field in some of these places who may have an interest in practicing their skills in a place that has weathered the pandemic a bit better. We know that the demand for mental health jobs will increase in the future. Can we look at using some of the tools in our labour force toolbox like Skills PEI or the labour market to be a bit more creative in promoting career opportunities in our mental health services?
The Honourable Minister of Economic Growth, Tourism and Culture.
Thank you, Mr. Speaker, and a short answer is absolutely, Honourable Member. That's something we've been working on now over the last 8 months, 9 months, to exactly of what you're talking about. So changing our skills programs around, looking at certain industries as a whole, where some of our gaps are, and for the first time in a long time, working between departmental lines to find out where some of these gaps are. So most certainly, the answer is yes.
Morel-Donagh, your second supplementary.
Thank you, Mr. Speaker. I know the LMDA has been adjusted in previous years for the steel and aluminum industry, for our forest sector as well. Will the minister commit, and I know we do some healthcare positions, will the minister look specifically into more mental health and addiction type positions for our LMDA?
The Honourable Minister of Economic Growth, Tourism and Culture.
Thank you, Mr. Speaker, and I'll certainly go back to the department, Honourable Member. I know my department has been meeting quite regularly with the Department of Health on some of the professions in the healthcare system. So I don't have a breakdown of what they've talked about there, but I'll most certainly go back and ask these questions and urge them to look at exactly this. Thank you.
The honourable member from Charlottetown, Victoria Park.
Thank you, Mr. Speaker. I've adjusted my questions a little bit since the Minister of Health and Wellness committed to the Women's Health Strategy being out for the fall of 2021. I hope that's a firm commitment. OBGYNs play a vital role in women's health care, not only for women who are or who want to become pregnant, but all women in all stages of life. I was concerned to see that it appears we have only 4 OBGYNs practicing in PEI compared to 7 this past fall and 9 just a few years ago. Question to the Minister of Health and Wellness. Are you concerned with the lack of OBGYNs on PEI? And is your department tracking how this is affecting wait times, outcomes, and women's health?
Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker, and thank the member for the question. And as I've said before here this afternoon, Mr. Speaker, we always have to endeavour to provide the very best quality of services to Islanders. With regard to the Women's Wellness Program, we have to look, yes, at, and kudos to the previous administration for getting it started, the Women's Health Centre in Summerside. But I also think that we have to look at, for example, the fertility support programs. That is extremely important to Islanders right across the board, a program that was not in place a very short time ago, Mr. Speaker, but that is in place and will be built and expanded upon, Mr. Speaker. Thank you very much.
The honourable member from Charlottetown, Victoria Park.
It seems clear to me that we don't understand why it's important to support women's health. Women's health looks different than men's health. Even at 9 OBGYNs, PEI has the lowest per capita level of OBGYNs out of all Canadian provinces. Question to the Minister of Health. I've heard from constituents with deliberating uterine pain who have been given wait times in the years to see a gynecologist. Do you think this is appropriate, and what are you doing for women who need these services now?
The honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker, and I would be more than happy to bring back the wait times just for information and for clarity, Mr. Speaker. But I think, too, going back, that we look at the initiatives that we have taken and that we're going to continue to take, Mr. Speaker, initiatives that were outlined in the budget with regard to primary health care, Mr. Speaker. Again, I'll reiterate that with regard to the questions that have been brought forward by the honourable member with regard to women's wellness, women's initiatives. Again, reiterate the health strategy, which will be brought down in the fall of this year, the women's wellness program, dense breast information and screening. Can we always do more, and should we endeavour to do more? Absolutely, Mr. Speaker. But I do feel that as a government, we are on the right track. As a department, we're on the right track, Mr. Speaker. Thank you.
Charlottetown Belvedere, final question.
Thank you, Mr. Speaker. I'm tempted to do another show of hands about how many people have waited more than a year to see an OB-GYN, but I won't. Instead, I'm going to ask about something else for the Minister of Health. Friends and neighbours in other provinces who have been vaccinated have received a digital immunisation record powered by the Can Immunise app. In fact, Nova Scotia is using this app currently. This record ensures people know which vaccine they received, reminds them to return for a booster of the same vaccine, and it will also help Canadians know if they're eligible to receive a COVID-19 vaccine as eligibility requirements change. Could the Minister of Health advise when digital vaccination records will be available for Islanders who have been or will be vaccinated?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker, and certainly an excellent suggestion or an excellent information that the honourable member has brought forward. I think you look over the last year plus a month, but the initiatives, the direction that has been, and the programming that has been provided by CPHO has served us extremely well, Mr. Speaker, and will continue to do so as we move forward. And, we do have to rely on the experts, whether it's Dr. Morris and other ones in CPHO within the department, with regard to what is necessary as we move forward, Mr. Speaker. So, again, thank the member for the question. But I will, as a government right across the board, we will continue to rely on the advice from the experts, such as Dr. Morrison. Thank you, Mr. Speaker.
End of question period. Minister statements. The Honorable Minister of Social Development and Housing, the Honorable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker. And it was mentioned by a number of different members here in the legislature today with regard to that they are sporting green shirts. Some of us, I'm not sure, maybe we're a little bit colorblind, but some of the shirts that have been referred to as being green, well, maybe not quite so much. But I'm certainly very happy, very proud to be sporting my green shirt and my green tie here today in support of Green Shirt Day, Mr. Speaker. And Mr. Speaker, Green Shirt Day, it's a day to remember the victims, families, and survivors of the devastating Humboldt Broncos bus crash. And Mr. Speaker, it is a day to honor Logan Boulet's life-saving legacy of inspiring others to become organ and tissue donors. April 7th became Green Shirt Day after Logan made the decision to become a registered organ donor just weeks before his passing in the Humboldt tragedy. Mr. Speaker, through his generous gifts, the 21-year-old defenseman went on to save 6 lives. In the weeks that followed, Logan's story inspired more than 100,000 Canadians to become registered organ donors, which became known as the Logan Boulet Effect. Today, Mr. Speaker, there are 4,400 Canadians still waiting for a life-saving transplant, and each year approximately 250 of them will die waiting. Mr. Speaker, 90% of Canadians say they support organ donation, yet only 32% have registered their decision. By raising the awareness of the importance of organ and tissue donation, we can all encourage more people to register their decision and save lives. We must all work towards a day where no one has to die waiting for a transplant. Mr. Speaker, Islanders can participate in Green Shirt Day in a number of ways, including wearing green to spark conversations about the importance of becoming a donor, spreading awareness online using the hashtags #GreenShirtDay or #LoganBouletEffect. Also, Mr. Speaker, by visiting greenshirtday.ca to learn more about becoming a registered donor. I also encourage, Mr. Speaker, all Islanders to register their wish at makeitzero.ca and to talk about their decision with loved ones so they can help fulfill your wishes. And Mr. Speaker, another reminder of the importance of registering as a donor is coming up later this month. April 18th to April 24th is National Organ and Tissue Donation Awareness Week. It only takes a couple of minutes to register your decision to become an organ donor online. Together strong, we can continue the momentum of Logan's life-saving legacy by inspiring others to become registered organ and tissue donors. Thank you, Mr. Speaker.
Tyne Valley, Shorebrook, the opposition whip.
Thank you, Mr. Speaker. Losing a loved one is an incredible hardship, and the loss to the Boulet family, I can't imagine what that family went through. I recently was struck by the mother's account of that experience and something that she's been sharing this year, the hope to meet the recipient of Logan's heart. And I think that it really just highlighted for me the incredible impact that organ donation has out of such loss, that we could have incredible life being given. And the laws in Saskatchewan don't allow for the donor family and the family of the recipient. They don't allow them to meet. And it's my understanding our laws do allow for this here, but it made me wonder, what we do, here to help facilitate that process, to ensure that both recipients and the families of donors are informed of that right, so that when it is right for both those both families to make that decision, they have that option. Because when I heard that Logan's mother speak, just the hope in her voice that she would hear her son's heartbeat again, we should do everything we can to help those going through this experience. Thank you, Mr. Speaker.
Honourable member from Charlottetown, West Royalty.
Yeah, Mr. Speaker, today is an important day, and it's a pleasure to rise and talk about it. Following the tragic Cumberland Broncos crash, and 3 years ago, Logan Boulay, as one of his final wishes, told his family about his desire to become an organ donor. And this was a courageous display by Logan, and it helped 6 other people save their lives. In many cases, organ donation is a tough conversation to have, and doing a lot of research on it. You never want to see anything happen to your loved ones, but if something does, how can that tragedy look to help other people? And that's exactly what happened. And we need to talk about it, because conversations are very difficult to have around this topic, but you can save lives. 11 Islanders need transplants. 11 Islanders at this time. We have to do more, and we can do more, and I think our society is moving in that direction. But the stats show that over 90% of Canadians support the idea of organ donation, but only approximately 23% of Canadians have gone through the process to register as an organ donor. And I know our government is doing stuff in that field. This is why I want to talk about the legislation in the next little while, to make sure that we're getting it straight, and that the people have those conversations, and that there's active campaigns that Prince Edward Island becomes the best and strongest place. It's in our nature to give as Islanders, and there's no better gift, and there's no better conversations to have, I believe, than this one to have with Islanders. So on Green Shirt Day, remember what it means, remember why we're doing this, and remember the love that we feel as Islanders to give to other people. Thank you, Minister.
And ministerial statements? Presenting and receiving petitions. Tabling of documents, Charlottetown, West Royalty.
Thank you, Mr. Speaker. Mr. Speaker, by leave of the House, I beg leave to table the Human Organ and Tissue Donation Act. I'm very pleased to make this act public for the first time, and the fact that it's Green Shirt Day only adds to the significance, Mr. Speaker. Organ tissue donation is an incredibly serious topic, and we must begin the conversation. Hundreds of Islanders are affected by this every year, and this legislation aims to make it easier for those who need life-saving altering surgeries to receive them. It's modeled after the Nova Scotia legislation, and I hope this starts an important, maybe sometimes difficult conversations within our province. So I'll be tabling that for open consultation. And I do that, and I move, seconded by O'Leary and Vaness, that the said document be now received and do lie on the table.
Shall it carry? The Honourable Minister of Education, Lifelong Learning, Minister responsible for the status of women.
Thank you, Mr. Speaker. By leave of the House, I beg leave to table the 2021 pre-kindergarten consultation statistics. And I move, seconded by the Minister of Transportation and Infrastructure, that the said document be now received and do lie on the table.
Shall it carry? Did I miss anyone? Honourable members, pursuant to Section 119 of the Election Act, I wish to advise that I have received the report from the Chief Electoral Officer regarding the 2020 by-election. I move that the report be received and do lie on the table. Shall it carry? No more tabling of documents. I didn't miss anyone. Reports by committees. Introduction of government bills. Motions other than government? Orders other than government? The honourable member from Mermaid Stratford and the opposition House Leader.
Mr. Speaker, I move, seconded by Charlottetown Belvedere, that the 26th order of the day now be read.
Shall it carry?
Order 26, Poverty Elimination Strategy Act, Bill number 107, in committee.
The honourable member from Mermaid Stratford, the opposition House Leader.
Thank you, Mr. Speaker. Mr. Speaker, I move, seconded by Charlottetown Belvedere, that this House do now resolve itself into a committee of the whole House to take into consideration the said bill.
Shall it carry?
Carry.
The honourable member from Tignish Palmer Road, Deputy Speaker, the Chair of the Committee of the Whole, please.
The House is now in a committee of the whole House to take into consideration a bill to be intituled Poverty Elimination Strategy Act. The request has been made to bring a stranger onto the floor. Shall it be granted?
What are you going to do when they say that?
Have they ever said no?
Temptation is strong.
Please state your name and position for answered.
I'm Nathan Hood, Senior Policy Advisor to the Official Opposition.
Thank you very much and welcome. Promoter, I understand you have a couple of housekeeping amendments.
We do. They were provided by Parliamentary Council to address some minor drafting errors, and
Sure.
we have copies for the House if they can be circulated. That would be. Did get a chance to
So can you read in the
Sure.
First Amendment?
Yeah, so the First Amendment moves that Bill 107 is amended by adding the following heading after Section 2, Part 2, Poverty Reduction and Elimination, and B, the deletion of subsection 7.5. And what this does is puts in the missing heading, because previously it went Part 1, Part 3, and it also removes a duplicated subsection. And these are both drafting errors that were caught after the bill was printed, and Parliamentary Council was kind enough to draft these minor amendments together for us.
Okay, honorable members, the amendment, everyone should have a copy of it. Any questions? Mermaid Stratford.
Oh, no, I'm just waiting for a copy.
Oh, sorry, okay.
Thank you
Okay,
very much.
shall I carry?
Carry.
Okay, we're now going to move forward with the bill as amended. So just for clarification, part one goes from, in our bill book, from one, which was the definitions, to two, purpose. Is that correct?
That's
Okay,
correct.
Okay. So we were on part one, and the floor is open for questions. Shall this part carry?
Carry.
Part two. Any questions on part two? Shall it carry?
Carry.
Part three. Any questions on part three? The Minister of Social Development and Housing.
Thanks, Chair. I just wanted to comment on Section 4, Section 4, which is groups to be considered.
Yes.
And I know, because we've discussed it, why you wanted to make sure you listed out all the groups to be considered. And indeed, it is a broad range of citizens. And the feedback from the department was, I mean, it is all citizens of Prince Edward Island, and I agree with that. I mean, because of course, eliminating poverty does impact, and we should consider all citizens of PEI. And maybe my question to you is just to clarify why you feel that you needed to list all these different groups specifically in the Act.
Thank you. Thank you, Minister. It's a really good question, Chair. And if I may, I'll just explain sort of the rationale behind that, and then I'll have my honourable stranger to sort of fill in the piece around the data side of it. So the groups to be considered must consider a broad range of citizens in its development and implementation, particularly those groups who are at a greater risk of experiencing poverty. And the list here is extensive, including children, young adults, women and persons of all genders, Indigenous peoples, persons living with disabilities, persons living in rural communities, immigrants and refugees, LGBTQS2 persons, persons of faith and spirituality, seniors, persons with families working and earning low incomes, persons living with or fleeing abuse, persons living with mental illness or addiction, black persons, persons of colour, and any other groups as determined by the Minister or the Council. As we discussed with the Department, while this looks like a very extensive list, and it is an extensive list, it's because each one of these groups has their own different experience of poverty, and therefore the programs and services that are developed and delivered to address those will need to look somewhat different. The experience of women in poverty, who are obviously the group that actually experiences poverty the most, is quite different from that of someone who fits into one of the different groups. Seniors obviously have different levels of income, different sources of income, and different expectations, including their ability to enter the workforce, for example. And we know that there are other social determinants, so the determinants experienced by people of colour from the BIPOC community could be very different because of the additional social barriers, that intersectionality that we often speak about. We also note that in some cases, for instance, with our Indigenous populations, that we would need to have different negotiations on how to deliver programs and services, because the delivery of services for First Nations people on reserve and off reserve is actually covered by different legislation, departments and services. So it's not only what programs and services are developed and delivered, but how we arrive at them. But obviously that kind of catch-all group at the end that we added, which is any other groups as determined, means that there is still yet within this further groups that we may not have thought of, that we would find as we go through the data that need to be identified.
Okay, Minister of Social Development and Housing.
Thank you for that explanation, and I think it really highlights how diverse poverty can be. But on the flip side, it also shows that that many of us, or maybe most of us, could be a small series, unfortunate, of events away from poverty at any given time as well. And that's why it's so important that society as a whole supports everybody. And so thank you for pointing that out. Chair, my next question would be on Section 6 review, and it's more of a statement. I just wanted to thank the member for changing this section so that that it's the minister that would could possibly request that the strategy be reviewed and updated, as opposed to leaving that up to only the council, because it could be a substantial amount of work. And so I do appreciate you, so I just want to thank you for making that change. That's it.
Thank you. Nate, did you want to add anything? No, we're okay? Okay. Thanks for that. I think, just a last comment on that, if I may, Chair, is that, it is a real struggle to understand the experience of somebody that isn't you. And when we put something into legislation that explicitly says that that's our responsibility, it makes it more likely that that will happen. And so that's really something that we see here. When we talk about that need for diversity, though it may seem obvious, again, we've talked a lot about this, about the things that we know to be true, but we actually have to write them down and state them in this case. And that was part of the intent of making this list as explicit as it is, because to ensure that no one is left behind just because we can't assume that they're okay. That's the context. Thank you, Chair.
You're welcome. Any other questions on Part 3? Shall Part 3 carry?
Carried.
Part 4. Any questions on Part 4?
Chair.
Minister of Social Development and Housing.
Well, thank you, Chair. And it's the section here that talks, it's 5.3, talks about the chair of council. And the council shall appoint a chair from among its members. This is one that we discussed within the department as well, and I wanted to raise it on their behalf. I'm not going to attempt to amend this or anything.
Thank you.
They would have preferred that the minister appoint a chair from among its members as opposed to the council doing it. They're concerned, they just want to make sure that the chair has all the skill sets needed to work with the department. It might have it's like an operational sort of impact. So I just wanted to raise that. We're going to give it a go and give it a shot at some point in the future. If for some reason it's not working out, and then maybe we will amend it. But I just wanted to raise that on the department's behalf.
Thank you, Chair. Thank you, Minister, for the feedback. And obviously, in our consultation with the department, we agreed to disagree on many points. There were many things that were raised by the department, which we obviously took on board and amended the legislation accordingly. But there were also many places where we push back to say that the intent of the bill needs to remain as the intent of the bill. And so I appreciate that your department is willing to sort of not choose that as a hill to die on and in this case, it is absolutely. I mean, once legislation passes, how that is implemented will be your responsibility. Obviously, we hope that the intent and purpose of the bill, as it's laid out, is honoured. But those pieces are things that, frankly, we find out when we put them into practice. And so that may be the case that once it gets rolling, we find that it needs to change, and that's okay, because legislation also needs to be flexible enough to adapt. The initial intent is to ensure that people have confidence that the council is as impartial and removed from influence from government as possible, so that they can be an objective voice that has the ability to be able to provide if necessary, criticism and constructive criticism back to government, as we see with other functional advisory boards who are able to do so. There are models where it works, so we would like to see more of them.
Any other questions on Part 4? Morel Donagh.
Thank you, Chair.
Thank you.
Thank you, Member. So, I mean, the obvious question is, the perceived duplication of roles between the Poverty Reduction Council and the council that your legislation proposes to do. Talk to me again about how you see these as two different roles.
They have different mandates, and I think there is a limit on what we can prescribe that happens within the legislation, because there is no legislation that mandates that current Poverty Reduction Council. It is a council that is in place as one of the actions arising from the original Poverty Reduction Action Plan. And so it would be, once this legislation passes, should it pass, then there is, that would be one of the things that the government would then sort of choose to do. I think, as I said the last time we spoke, there are a couple of major factors there. Is that council has significant experience with the existing Poverty Reduction Action Plan and engagement with community stakeholders, as well as lived experience on as well, and that is invaluable in terms of where you choose to begin. So that's one piece. The other side of this is that the Poverty Reduction Action Plan does not have the same teeth that a legislation would have, and it did not have targets. And so that council has been, in my opinion, somewhat challenged by having a mandate that can be enforced. Without those targets or clear accountability, it provides an advisory role, but has been limited through no ill intent, but just the scope is relatively limited. This council, as we're recommending, really could begin from that basis of that existing council, or you could start from scratch, and that's entirely up to the guidelines of how membership is determined. But the alignment is there in terms of providing a council with clear accountability, guidance, and I said, and teeth to actually do its job of holding government to account and moving this file forward in a way that we haven't been able to consistently with the previous council.
Maura Aldona.
Thank you, Chair. It's interesting you say with teeth. I'm not sure what the teeth are, other than just saying that they have to do it versus saying that the strategy have to do it too. Would you, when you talk to the Poverty Reduction Council, do you get the sense that the creation of this act will, I don't want to say end their work, but basically end that council and morph into the new council that you're creating?
No, I don't. I mean, I think there's, looking at the minutes of the Poverty Reduction Council and their activities, they've been moving some of the clear action items forward, or have been providing input on those. But in the absence of targets and that sort of direct accountability back to the department, there is a very big difference between an advisory council that can kind of comment on policy or activities or provide some form of consultation body, and a council which has a level of accountability against set and agreed legislative measures and targets. I am not in a position to comment on how this government would go forward recruiting and building that new council, because we have a process for that, which is independent, which is Engage PEI, and that was certainly, when we discussed with the minister, that was the preference of the department, would be to use Engage PEI as a likely model to build a new board. I don't know what model was used to build the original Poverty Reduction Council, but I don't believe it was Engage PEI. I think it was by appointment. But that's the extent that I'm able to comment on it, because I'm not on that board.
Maura Aldona.
Thank you, Chair. Can I have intervention from the minister to find out how that board was originally created, if they were created outside of Engage PEI?
Do you want an intervention?
Well,
Assistant to Social Development and Housing.
Oh, thanks, Chair. And so I'm going to verify that 100%, whether it was Engage PEI, whether it was appointed. But I think it's important to note that the Poverty Elimination Council is one we do plan to go to Engage PEI with. We've discussed it and looked at that. And I think, as the sponsor of the bill has said, and as the member has pointed out, it wouldn't probably make sense to have the two working side by side, and probably we would see the Poverty Elimination Council sort of take over the other advisory council, and hopefully, as the sponsor said, probably see some of the membership transferred over. It does remain to be seen, and these are some good points. One thing I wanted to comment on was, I mean, if you look at a lot of the pieces of the bill, I mean, even the targets, you could say these are things we were working on in the department anyhow. And when the sponsor says this has teeth, I think when you put something in legislation, it tends to carry forward from one administration to the next as well. And that's why I think it's important, and I do support this bill, because it does take things that, yes, we may be working on, we may be doing, and it adds some good things in there as well, but it formalizes it, it puts it in legislation, which of course has to come to the floor of this chamber in order to change or remove. And it does add that consistency and shows the seriousness that we have about poverty elimination. And again, I also want to comment on the fact that that language is used, and I want to thank the sponsor. It's not poverty reduction, like we had a poverty reduction strategy, now it's a poverty elimination strategy, and it's important to have aggressive targets and work towards that. Thank you, Chair.
Or Aldona? You're welcome. Any other questions on this part? Shall this part carry? Carry. Part 5. Any questions on part 5? Shall this part carry? Carry. Part 6. Any questions on part 6? Minister of Social Development and Housing.
Well, thank you, Chair. I just wanted to look at the referral to Standing Committee. When the report is tabled in the Legislative Assembly, it stands referred to the Standing Committee on Health and Social Development or other such standing committee as the Assembly may order at the time. I just wanted to make a friendly amendment here. Instead of referring to the Standing Committee on Health and Social Development, as we know, standing committees do change from time to time, and that would require, of course, an amendment to the legislation every time they change. So I believe the clerk does have copies of the amendment, and
would you please
if I could put a motion forward?
Yep.
So this motion amends section 7.3 of Bill number 107 by deleting the name of the Standing Committee on Health and Social Development and substituting a reference to, quote, the Standing Committee responsible for matters relating to social development, end quote.
Thank you. So members, copy is circulating at the moment. I'll give you a moment to have a look at it, and then I'll open the floor for questions.
Thank you.
So just to be clear, Chair, I do move we make that amendment. Not sure I phrased that properly the first time I read it. So.
We'll let you pass.
You did fine. So everyone have an opportunity to read it. Are there any questions on the amendment? Shall it carry?
Carry.
Okay, we're back to part 6 as amended. Any other questions on part 6 as amended? Shall it carry?
Carry.
Part 7. Any questions on part 7? Shall it carry?
I was going to speak to that, but I didn't.
Shall the bill carry? I move the enacting. Sorry. Okay. Good. Oh yeah.
I move the title.
Poverty Elimination Strategy Act.
I move the enacting clause.
Shall it carry? Hey, sorry, I'll have to read the enacting clause first. Is that correct? Okay. So, you need some eyes.
Oh, he's getting the eyes on.
Whereas poverty is a primary social determinant of health, and whereas poverty leads to poorer social and economic outcomes, especially for children, and a lack of proactive action to address poverty can increase the depth of poverty and make its elimination more difficult. And whereas poverty is a complex issue that requires bold and creative approaches to understand and address the real causes and consequences of poverty in Prince Edward Island. And whereas there is a need to establish clear definitions and measures of poverty in Prince Edward Island so as to set appropriate legislation and policy targets. And whereas there is expertise available from community organizations that have studied this issue and can provide insights. And whereas the Government of Canada adopted the United Nations Sustainable Development Goals of reducing poverty by 50% in 2030. And whereas the Government of Canada has directly increased financial resources for families with children and for seniors in its efforts to reach its poverty reduction targets, therefore being enacted by the Lieutenant Governor and the Legislative Assembly of the Province of Prince Edward Island as follows. Shall it carry?
Carried. Mr. Chair, I move the Speaker take the chair and that the chair report the bill agreed to with amendment.
Shall it carry?
Carried.
Mr. Speaker, as Chair of the Committee of the Whole House having under consideration a bill to be intituled Poverty Elimination Strategy Act, I beg leave to report that the committee has gone through the said bill and has agreed the same with amendment. I move the report of the committee be adopted.
Shall it carry? The honourable member from Mermaid Stratford, the opposition House Leader.
Thank you.
Mr. Speaker, I move, seconded by Tyne Valley Sherbrooke, that the 24th order of the day now be read.
Shall it carry?
Order 24, an act to amend the Health Services Act, Bill number 106, in committee.
The honourable member from Mermaid Stratford, the opposition House Leader.
Mr. Speaker, I move, seconded by Tyne Valley Sherbrooke, that this House do now resolve itself into the Committee of the Whole House to take into consideration the said bill.
Shall it carry?
Carried.
The honourable member from Tignish Palmer Road, the Deputy Speaker, to chair the Committee of the Whole, please.
The House is now in a committee of the whole House to take into consideration a bill to be intituled an act to amend the Health Services Act. Request has been made to bring a stranger onto the floor. Shall it be granted?
Granted.
Good afternoon. Would you please state your name and position for Hansard?
Michelle Patterson, Research and Communications Office with the Office of the Official Opposition.
Thank you very much. Good afternoon and welcome. Honourable members, this floor is presently under debate. It's opened up as a whole to questions. Are there any other questions? Pardon me? Oh, sorry. The Honourable Premier.
So I missed the early part of the debate, so I don't want to wish to revisit all of that, but just in the general sense, the Coles Notes version, what exactly does this change or amendment do to the operations of Health PEI?
Okay, so this act is to repeal changes that were made in 2018 that saw some powers shift away from the board to the minister. It's the one change that I did keep from 2018 in this bill is guaranteed representation from the east and from the west of the island. So with these changes, it would allow the board to be able to make decisions about the day-to-day operations of Health PEI. However, the strategic plan and budget and business plan would remain with the minister as needing to approve those. So it's one small part of the process that the board would have authority over. Michelle, is there more that we need to add in the Coles Notes summary?
I think the only other thing that I will add is actually the Minister of Health last time that we were on the floor brought up a good point that I missed. So my mistake was that the Health Services Act in Alberta actually does have a clause in it that allows the minister to do whatever, whenever. Their board appears to be arm's length, so that was my misunderstanding, but it does have that clause. But when looking into that, I actually found an AG report from the office in Alberta from a few years back that called on the Alberta health system to depoliticize their healthcare system approach. That's their words, not mine. But it was calling on amendments to the Health Services Act, which is currently very much like ours is written. And they were calling for amendments that we are proposing right now. Again, to pull the politics out of the healthcare system, which reminded me of the statement made in this House by the Premier just a couple of weeks ago, asking to remove politics from mental health. So I thought that was an interesting point that the Premier might be interested in.
Yeah, thank you, Michelle. And just to note, I did table that report as well, the Auditor General's recommendations in Alberta.
Honourable Premier.
Yeah, I do appreciate that. I do think to the extent we're all able to, that we should try to take the politics out of not just health, but a lot of the decisions we make here. The tricky part of this situation becomes when the health board, for example, decides what the school board did a few years back and says, it's our recommendation that you cease operations in Alberton and Kings County, for example. So is there any possible intervention then for the minister or politicians in general, or how would such a decision be delivered?
So I think it's an interesting way to look at this, to think that a board of 7 to 11 people who have been chosen based on their expert knowledge of the healthcare system in PEI would choose to do things that would be against the well-being and the betterment of our healthcare system. Rather, it is much more likely that one person, one minister having that power who is making decisions, not necessarily, it doesn't have to be transparent. The board, their meetings are all public record. The far greater risk, and this is not to say of this particular minister, this is about long-term decision-making for PEI, is for one person to have the ability to make a drastic decision that could be based on any number of things that are not evidence-based for healthcare outcomes. And as Michelle mentioned, the possibility for political interference is always a concern. When we are making decisions that might impact, as you mentioned, one area of the island versus others, with one person from one location having that ability to perhaps make those decisions on their own independently without accountability is, to me, a far greater concern. Michelle, did you want to add anything to that?
Yeah, I think I'll just reiterate that when I was looking back over last week, I go home and read Hansard, as I'm sure you all do, and looking over some of the looking over some of the points that were made around accountability of a minister and an elected official, is that this House is accountable to Islanders, but an individual elected official is accountable to their constituents. And there is that difference there. So I would like to point out an example that was given by the member from O'Leary-Inverness, and it was a good example, don't worry, that at his time, he wanted a service for his community, and he worked with the board to actually get that service. So it's possible. Kudos. But that can be actually a very dangerous outcome without the checks and balances of a board, because the way our healthcare system is, and the way all healthcare systems across Canada is that their resources are used to their max. We don't have an abundance of nurses running around looking for work to do. So when a minister or any elected official or anyone chooses to pull our healthcare system in one direction by adding a new service, if it's not done with mitigating things in place, it can actually buckle the service somewhere else. So adding a service in one area in O'Leary-Inverness, if we don't have a board and a group of experts working with us on that, then there's a potential that we could lose services somewhere else, and that the hospital in the eastern part of PEI could actually lose those services. And that's what we don't want to happen. We don't want Islanders to lose services. We don't want wait times to increase. We don't want to lose our professionals, and that's what can happen if we make quick decisions by adding services without taking the entire system into account. And that's where, from the evidence that we know, a board and a group of individuals does, in general, a better job at putting those mitigation resources in place to ensure that things like that don't happen, while at the same time providing services that Islanders want and need that this House brings forward.
The Honourable Premier.
Well, I appreciate all that, but my question was more specific to, say the board comes down and says we're closing Alberton Hospital and Montague Hospital. Is there a role for anyone in government to have a role, or is the role of government just to sit here and respect the decision and take all of the political salvos that come across the board on this? I'm just trying to figure out the accountability component of all this.
Well, first of all, so the minister, as I said, is still responsible for the strategic plan and the budget and the business plan. That strategic plan can be quite detailed in terms of what would be the goals of our healthcare system. So it can be quite clear in there that you would, the minister would not want to see the closure of rural hospitals. But I want to stress that this idea, again, of this worst case scenario that 7 to 10 good Islanders who are taking on this role on a board with experience in healthcare would make radical decisions, there's no evidence to suggest that that is the case. And in fact, there is considerable evidence to suggest that one individual could make random decisions that are not based on evidence. So if we are, really looking at what is the system that is going to result in the best health outcomes for Islanders, effective long-term planning for our healthcare system that takes into account all aspects of that system, then the board is best suited to make those decisions in the long term for the day-to-day operations of the healthcare system. Michelle, is there anything else to add to that?
The only thing I'll add is that the Premier stated, how is that accountability put in place, and the legislation actually has an accountability framework built in that the minister should prioritize regardless if the amendments are put in place or not. But how that accountability runs is actually up to the minister. So they would decide what that looks like and how those steps would take place. So that would be up to you.
The Honourable Premier.
So the minister could come in and say, sorry, board, we're not closing the 2 hospitals under your bill or amendment?
I again want to stress that this
Well, it's a legitimate
doomsday
question from the
scenario.
because if you look back at the recent history,
Yeah.
there was a school board, just as you talk about here, who actually come out with a solution based on what they determined were facts, et cetera. But the government came in and said, the heck with you, school board, we blow you up, and we're gonna do this ourselves. So there is some precedence here for the questions,
Yeah.
you know, so it's not radical that a board would say to save resources or to maximize the efficiency that they might want to do that.
And so I do want to point out as well that I think that, you know, any government in PEI would prioritize maintaining and expanding and building on access to services in rural PEI, clearly stating in any strategy that rural PEI is an important component that must be considered. And as I stated, the strategic plan that the minister still has that control over could very well and should very well clearly state that it is not part of the plan to close rural hospitals. And the board must then work toward the goals that are outlined in that strategic plan. So the minister is ultimately responsible to ensure that that is clearly outlined, the goals that we are working toward in our healthcare system, including supporting rural islanders, would be outlined in the plans that the minister still has very much control over. It's just that step of how do we actualize those plans? How do we make them a reality? What is the best way to move forward in a direction that will actually allow us to achieve the long-term goals that we have set out, that the government has set out, you know, for our healthcare system? So it would be in the purview of the minister to set those goals and then for the board to actualize the goals. Michelle?
Yeah, I think the answer you're looking for is yes. The minister and the government will always have ultimate authority. That if you look at the school situation, the government were able to step in under, you know, the what-if situations. The government has authority over this. The other thing to keep in mind is right now the board does not have any authority over a minister making poor decisions. Whereas if our amendments are put in place, yes, the minister and the government always have ultimate authority.
The Honourable Premier.
I can't speak to how it worked before we got here, but I mean, we've appointed a new chair of this board who is trying to work with the members of the board and the staff of Health PEI to find the best workable model for this. And I think that's a good place to start. But, you know, operationally, Health PEI delivers the service for PEI. That's what they do under the guidance of the board. So when you all sit in the legislature and say, why did you relocate to POC? I mean, that's not a decision that the Minister of Health and Wellness walks in one day and says, let's move the POC. These are the experts that you talk about who say, this is how we have to operate because of this, this, and this. So I'm kind of curious to know why that operational work of Health PEI, how that's not acceptable based on a lot of the questions, very good questions that you asked, but why it's not acceptable for operations, but we should take that and transplant it to the board itself.
And I think there's definitely a few components there. So as I mentioned, transparency is a huge component of this. So when the board makes decisions, the minutes from their meeting are made public. What we've seen is a lot of confusion. I don't want to go down the road of giving too many recent examples, but over who is making decisions when and why. So allowing the board to function as a board for Health PEI to make decisions about the day-to-day operations brings clarity to how and when those decisions are being made. There's a process, and it is made public how that happens and what is happening. So that's one really critical component here that this change would allow for. Michelle, did you have anything else to add at this point? Or?
I think I would also, your statement that the puck wasn't closed by the minister, it was closed by Health PEI, there's actually no way for Islanders to know that with this current legislation. This current legislation means that the minister may have one day said, we're closing the pucks. And there is no process or policy or transparency for us to know for sure if that was in fact the case or not. I hope it wasn't. But under the amendments, then the Health PEI board, their minutes are public, and it would add to that transparency.
But
Sorry.
Health PEI board wouldn't say close the pot. The operational staff, I think the water's a little bit muddy with that. I think I know where Michelle's going with that, but I think they're two different things. They're not going to, at a board meeting, say, operationally, we ordered you to close the pot. They're going to give you the overall direction of what the board would like to see, and then Health PEI professionals are going to try to operate within that guidance and the principles that they lay out, I'm assuming.
Oh, I see what you mean. So things that are currently under the purview of the Health PEI staff would continue to be, that our changes don't change anything in terms of the current structure that way. And in fact, in terms of Health PEI staff, Dr. Garnham has expressed his support for these changes as best practice in terms of healthcare systems across the country and what he feels we should be moving toward. And these changes would really, we've seen a shift, right? There's this government has made some significant changes to the structure of Health PEI, and I've, publicly said that I find that, I'm optimistic, that those changes could be quite positive. And in saying that, I believe we must listen to the healthcare experts that you have entrusted to do that work. And Dr. Garnham, feels that this will support the work that you're already starting. So this is a component of that, I would say. It will move you forward.
Honourable Premier.
So if we are to pass this amendment, will you ask all of your questions to Dr. Garnham?
Again, this is not, I want to be really clear. This change does not shift all power in every way to the board. In fact, it is a small part so that the board can actualize the strategic plan that the minister sets out, and that is, the minister's role. I believe if you will look back at Hansard from 2018 and before, there were still many questions to ask the health minister.
I'm sure there will be.
So I don't think that would change.
Yeah.
Sorry.
No,
I'll still have more
Honourable
questions.
Premier.
But I think what is being sort of amended here is you kind of want the best of both worlds, essentially. And I don't know, this act will outlive you and me and others, certainly me. But in terms of its effectiveness, et cetera. But I think ultimately the minister is responsible, he's held responsible in here for the decisions based upon the direction from Health and Wellness to Health PEI as well as the board. But operationally, this person to my right is responsible. He's the one that's held accountable in here. So the questions of all of the changes that we've made that we have been under scrutiny for in here during this session and beyond, based on the best expert advice from the people who actually do this every day, we never hear of that. We only hear of, why did you do this or why did you do that? And I think this is the difficulty that I have with this in particular, is that I think, this is where the responsibility lies. We work very closely with the board. We work very closely with Health and Wellness. I'm just not sure what this change gets us, or maybe I just need more explanation of what it's going to do.
So The reality is that, yes, the minister must work very closely with the board, and that is, true now as it would be with these changes. Now, it does require, and I've said this already, that it does require a lot of work to build those relationships and really work collaboratively. That type of leadership it doesn't require that you hold on to every last bit of power. It is about how do we really make that collaboration work, and what are we doing that is working toward the best health outcomes of Islanders. So if we want to create a system that leads us to the best health outcomes for Islanders and the best long-term evidence-based planning, this system that I'm proposing is going to move us in that direction. If that should be the primary concern. If the primary concern is that it's going to make the Minister of Health's job a little bit more difficult, and that...
I'm so worried about that.
Well, that's what
No.
So the Minister of Health job is difficult, and that is not, should not be our primary concern in making decisions for our healthcare system.
Oh, I
The Honourable Premier.
fundamentally agree with that. I don't think any of these jobs are easy, yours included. I don't think any of them are easy, and nor should we seek to make them easier. We're trying to do the best we can in the delivery of service. What does the makeup of the board, what goes into the makeup of the board? And if we're going to rely on 7 or 8, like I know the most recent appointment we made was Dr. Richard Wedge. So he brings a lot of expertise from the health perspective too. But are all of the people on the board required to have a health sort of perspective in terms of how they get appointed? Does that discuss in any way? Because I think if you're going to leave the entire decision-making and directive process to a group of individuals, should they have some specified knowledge in some of these areas?
And this is another area, again, that would still be completely under the purview of the minister. So the minister appoints the board. These amendments don't change that. And, as you noted, Dr. Richard Wedge, fantastic addition to the board because of his, extensive experience in healthcare. And it would be the responsibility of the minister and government to appoint people with that same level of experience. It is in the language in the Act would guide the minister to make decisions based on that, and in good faith, I would expect that would be what the minister would do, but that would continue to be under the power of the minister. It's one thing that can change.
The Honourable Premier.
Thank you very much, appreciate it.
Any other questions? Shall the bill carry?
Oh, Sidney.
Pardon me? Oh, sorry, I'm sorry about that. Morel Donut.
Thank you.
Actually, Morel Donut, if you could keep that question, if you don't mind. It's 3:10 and it was a time. Sorry to cut you off.
I've been on this list 3 times.
Yeah, but we are moving over to a different a time, so I'll have to ask you to call for adjournment.
Sure, of course. Mr. Chair, I move the Speaker take the chair and that the chair report progress and beg leave to sit again.
Shall it carry?
Carry.
Carry. Mr. Speaker, as Chair of the Committee of the Whole House, having under consideration a bill to be intituled an Act to amend the Health Services Act, I beg leave to report that the committee has made some progress and begs leave to sit again. I move that the report of the committee be adopted.
Shall it carry? The honourable member from Cornwall, Meadowbanks, and the third-party housekeeper.
Bill 33. I'd like to call Bill 33.
Shall carry.
Carry.
Oh, Bill?
Motion
Motion
33, sorry.
yeah.
Yeah.
Yeah. Now, Gerd.
Motion number 3, a doctor for every Islander should always be government's goal. Debate was adjourned by the seconder, the member for Charlottetown West Royalty.
The honourable member from Charlottetown West Royalty.
Mr. Speaker. I think this is a great motion that I'm going to speak to for a few minutes because it's very important, and especially the last. Therefore be resolved, this House endorse the long-standing goal of providing a doctor for every Islander and continue to make the effort in constant pursuit of this ideal result. And that's what we're trying to look at here. And over the past, since the speech from the throne, it was almost like this government took a different step. Before that, when they came in, this seemed like a novel idea that they were going to get somewhere and they were going to make this happen for Islanders. And since the speech from the throne, seeing a different tact, or what I kind of talked about when I only had 2 or 3 minutes, was it was a dead pivot. It was a dead pivot stop and a move in another direction. And some things in life you can do that with, but with recruiting doctors, I'm not sure that's the right approach. And I mean, we're all about innovation. We're all about trying to get the best health care for Islanders. But to completely stop on this notion and move in a different direction is not good planning. And if it is good planning, you know, the absence or sense of any details of what the government calls healthcare neighborhoods, home hubs, homes, I'm not sure. We don't have any details on what this is going to be, who, where, who will provide the services, the teams, you know, additional funding. The minister has often talked about staff. We're in a staffing crisis in a number of allied health professions, and we're moving in a different direction. What are we going to do in the meantime? There's got to be a transition period in there. We see in the budget that there's a little bit of money for health homes, and there's going to be 3 health homes, but where are those going to be? And when you break down that money will not be enough to provide the services for thousands of Islanders that need that service. There's no indication about the ballooning registry and how that's managed. I asked the minister how many seniors are on that registry. I'm still waiting for an answer. I'm worried about who is on that list and how they get prioritized. It seems to be going in one direction when we should be taking that list and it should be shrinking. It's going the other way. And those are Islanders. Those are people with families that can't have access to the medical supports they need. You look at the situation where the minister's using words like absorption last week to describe how things are merging. And I mean, healthcare is not sponge care. It's healthcare, and there's no absorption of programming. Okay, that's just a buzzword for we don't have the staff, we aren't ready, we're in a crisis situation, and we weren't prepared for this. Well, 2 years into your mandate right now, it's time to be prepared for this and moving forward. I looked at there's a recent, Mr. Speaker, well, not recent, I mean, it's about 10 years old, a movie. It was based in Newfoundland, and the movie's title was The Grand Seduction. You know, you see it maybe every year on TV on a Sunday afternoon sometime. And it's based around the presence that this community couldn't get a doctor in very rural part of Newfoundland, and it's a comedy. And this community did absolutely everything to get this doctor to come in. And it was Dr. Lewis at the time, Critch or somebody off of Friday Night Lights, I think the actor was. But it's a very good movie because it showed the amount of passion that this community had to change the healthcare system and to do it themselves because they weren't getting the support of the local government or the community government. They did it themselves. They had lineups. They were sneaking the doctor in to here and there. They were doing everything under the sun to make sure that their community and that mayor gave the support needed, okay, to give his people the adequate service. And I mean, throughout the movie, the doctor ends up falls in love with the community and stays, and it turns out really well. Well, this is what's happening in Prince Edward Island. Do communities have to get together and scream and yell and say, hey, we want a doctor. I need a doctor. My mother needs that. She's been waiting patiently. She's been waiting in line, and it's still not there. And this speech from the throne, when you talk about the process won't be evolutionary, it needs to be revolutionary, or, you know, it's that buzz line in the speech. I mean, we need all hands on deck. If you let up off the gas, we can't achieve the goals that we need for Islanders. And that's a very scary outlook. What we're asking for is a clear plan. How are you going to get doctors? And I know you put in, you worked hard for your first year, and the former minister did that, and he was on doctors recruiting doctors, and it was very difficult to get information out of that program and how that was going to look. Now we have that service in there, but we haven't heard a thing about it. Is it working? Are we able to get more doctors? We hear about it today about gynecologists and how we're very short on gynecologist specialists. That's a whole nother topic about how we recruit doctors and specialists to Prince Edward Island. There's huge gaps in our province. You can't recruit people, professionals in other fields to Prince Edward Island that we desperately need if they're not going to get the medical services that they deserve when they do come here. When you look at the Islanders without a doctor, if they get God forbid, cancer, heart disease, diabetes, or even, Mr. Speaker, if they falls prevention. I'm not sure, I talk a lot about it. I've done a lot of research on falls prevention. This is very serious. If they don't have a doctor, it makes navigating the system that much harder. These are the things that are happening to Islanders now. And the services need to be there. And you can't take your foot off the gas on this one. And if you talk about buzzwords, you can't talk about changing systems and models without constantly realizing that the doctor is the center of that. And if you're going to do a home hub or a home health care, I mean, I understand, but who's going to facilitate those places? People need, and they understand that we have an aging population, and as seniors age, they need more access to health care, and it starts with the doctor. Those other allied professionals are incredibly important, but it starts with the doctor. And I do believe, Mr. Speaker, that the government has lost the pulse on this. You look at communities like the BIPOC community. How are they going to access doctors coming here and trying to make a life and a family? It's very difficult for them in that community to even get access to medical services. The stats are staggering. Dr. Heather Morrison called it a public health emergency. 3.7 years, or over 3 years that we have people leading the nation or close to leading the nation in long-term care stays. I mean, I know this government is you're trying to do stuff about a few things about home care, which I'm an incredible advocate about, but we are so far down a crisis situation with our health care. And I feel like we've lost a couple of years on this file. You know, it's very frustrating. It's very frustrating to receive calls when Islanders have worked their entire lives and a doctor leaves, then they call you and they say, what do I do now? How do I get a doctor? My husband hasn't used the service in a very long time. His doctor's not here. His health's failing. I'm staying strong for him. And here we are. And they're scared. You can hear it in their voice. Every MLA has heard that. And what do we say on the other line? Get on the Payson registry when every single MLA knows that that is a 16,000 person plus registry. Some of the stats in Canada, our national population is growing by 4%, but the amount of doctors we produce is at 12%. Okay, we're producing more doctors. Okay, but we're just not able to get them here in Prince Edward Island. In Prince Edward Island, our doctors are retiring and will be retiring at an alarming rate. Almost 50% of the doctors will be retired in 10 years' time. Okay, we can't take our foot off the gas on this file. Clinics have been a good thing. We've tried. The emergency rooms are struggling now. When you say to somebody it's over 70 or 75, you're not feeling well, go to the emergency room. I mean, that could be, you might be telling the person to stay there 10 or 12 hours. 16,000 people on this registry, and we're telling people to go to the emergency room. I mean, they've worked too hard for that. Business professionals need to come. The first thing they ask about an innovation PEI, and the minister would know, is that if they're going to bring a startup firm here or a big firm here, they want to know about health care. They want to know if their people can receive health care, because it is a recruiting tool. That's happened. People have fallen in love with Prince Edward Island and said, you know what, I'm going to make another choice because I'm not very comfortable with the health care and the registry and the list. Talked to somebody recently in my district who was excited because they know about the healthcare crisis. They know about the doctor shortage. And this professional in the health field said, hey, I have a doctor wants to come here from Australia, wants to come, COVID wants to get out of Australia, wants to come here, and looked at the rules governing this, and said, I can't do it. PEI rules don't allow me to do it. I'm going to go choose another place to go. Well, it's about when the doctor would get in. There's restrictions that are set up within our province that wouldn't make it as easy for him to come.
He's qualified, or she's qualified.
Minister, the member has the floor.
Thank you. I'm just telling you, I'll stand up here as an MLA and say, I might be wrong. Prove me wrong. Prove me wrong. Okay? But that's a doctor. It's up to you. Go ahead and do it. It is. But when you hear that, when you hear situations like that, you have to say, hey, are we doing enough? Are we doing enough to attract the doctors here in Prince Edward Island? And it should be our goal. We know the problem on PEI is not equally shared by our neighboring provinces, as evidenced by the percentage of our population on the registry. 10.3% and rising, Mr. Speaker, every day. Island population is on the registry, compared to 6.1 in Nova Scotia and 5.7 in New Brunswick. So we are falling behind our neighbors. We're falling behind giving Islanders the best service we can possibly give them. And I mean, I hope that home hubs work or home centers work, but I understand what you're doing. You're trying to see more patients with less doctors because they're hard to get here. And I understand that. People will get the service, and I know the models, and I understand it. I've looked at the CHI documents. I've looked at the family physician's report from 2018. I know this. I understand it. I know where PEI sits. But we need to do more in Prince Edward Island. I'm just worried about those situations, and I'm worried about the depth of our healthcare system. When you look at long-term care, when you look at some of the situations that we went through during COVID, some of the decisions that were made by ministers and others in that situation, were they in the best interest? Were they in the best interest of the patient? Are they continuing to be in the best interest of the patient? Because what will happen too is that if you don't feel the pressure right now, Minister, if you don't feel that tinge in the bottom of your stomach, okay, you've lost control of this, and you need to understand that doctors are very, very important to Islanders. And the information and the speech from the throne and the information in the budget is not good enough for an opposition party, and we are going to be relentless on this. Whether it's good politics, whether it's not, this is important to Islanders. This is important to the people in my district. There's not going to be an overnight solution. but we have to keep trying every day. We have to keep working towards this as a goal. And we have to be relentless together to make this happen. It's going to take planning, it's going to take a strategy, and it's going to take openness about some of the areas that you're struggling with. Health PEI. There's more acting directors in Health PEI than a play at the Georgetown Theater right now. You know, we're losing our directorship, and people are trying to fit in the different holes. And I've got to implore the minister that doctors and nurses the nurses that I'm talking to are struggling in the system. During COVID, post-COVID, it's a difficult place to work in the healthcare system in Prince Edward Island right now. And it's all hands on deck to make sure that they're supported, that they're valued. Retention and recruitment of those different fields are incredibly important. And I mean, I know there's a lot of money in there right now, but did it come too late? Are we making the right moves now that we should have made before? Because Islanders deserve it, and they deserve strong access to health care, and doctors are the foundation of this. And I feel like for every announced doctor, we might lose 2 or 3. And we try to sweep those ones under the rug and announce the one we get. It's a scary situation, but this motion being brought to the floor of the legislature is very, very important. And I fully support this motion, and I'm proud to second it, because I do believe that Islanders want this and they need this. And I'm expecting some more details on the new pivot, the debt pivot that I'm very scared about, and it makes me have a pit in the bottom of my stomach just hearing about this. And I hope it works out, but I still believe that you can't take your foot off the gas. Okay, we need doctors, and we need them now for Islanders. Thank you very much, Mr. Speaker.
Honourable Leader of the Third Party.
Thank you, Mr. Speaker. At the podium, please.
Podium, please.
Thank you very much, Mr. Speaker. It's certainly a pleasure to rise and speak to this motion. I want to thank the Honourable Member from Larry Inverness for bringing it forward, and the Honourable Member for Charlottetown West Worldly for seconding it. Mr. Speaker, since we've been sitting in the legislature, the Premier and his government has taken every opportunity to call for reduced political posturing on the healthcare file. It doesn't take a lot to see that this is their newest dodge when they face fair and balanced criticism for their complete mishandling of the health file. And Mr. Speaker, you know, they've been saying a lot over there. Can we do better? Yeah. Do we need to do better? Yeah. Well, it's time they start doing better. And we hear from a lot of Islanders, and you know, we get accused of criticism and being negative over on this side. We didn't all get elected to be in government, and there's an opposition over on this side. And myself and my 4 colleagues, it's our job to bring concerns when we hear from constituents, and we've been hearing many in the last little while. And you know, it's not fun to stand up, but you know, we don't criticize any one individual. We are criticizing the government and some of the decisions they're making, and we have to refer to the minister or the premier. But that's not a personal attack. That's just, why are they going in that direction? You know, we've heard about these medical homes, these medical communities. Well, then all of a sudden it's going one way, the next day it's going the next day. We find out they met with the unions after the fact. They met with the unions before they come in the house one morning. It's like they're spinning their wheels after they make an announcement. So it's our job to bring these things forward. And that's what we'll continue to do as long as we're on this side till we get back over to that side. So, Mr. Speaker, criticism is part of our job. And governing comes and that comes with the territory of government and governing, especially when you have seen a government decide to give up on finding doctors for Islanders in need. Mr. Speaker, Islanders know how hard physical recruitment can be. They've seen it year after year. But one thing that I have consistently heard from my colleagues since the Premier decided to give up on family physicians for Islanders is confusion, not anger, not despair, but confusion. Mr. Speaker, Islanders are confused as to why this Conservative government would simply give up trying. They are confused as to how this Premier and his government can decide overnight that some Islanders don't deserve a family doctor. And they are worried for the reasoning that went into the bizarre decision. Now, Mr. Speaker, we are all very honored to be in here. We all worked hard. We got elected. But for the ones of us in here that have a doctor, I call that a privilege. And I have a doctor, and I'm very grateful. But I have neighbors that don't, and I have lots of constituents that don't. And the patient registry continues to climb, and I'll get into the numbers later. But, you know, that's something that's near and dear to us. Mr. Speaker, as I said, Islanders are confused as to why this Conservative government would simply give up trying. They are confused as to how this Premier and his government could decide overnight. Sorry, I guess I already read that. Anyway, Mr. Speaker, the patient registry has ballooned under this government. And the Minister of Health can spin the figures any way he wants, but it's a simple fact that there are more and more patients on this registry than at any time in recent memory, or probably in history. Mr. Speaker, the Liberal Party and my caucus are committed to working towards a goal, as lofty as it may be, of a doctor for every Islander, because we know and we believe that at the very best, Islanders deserve a government that is willing to try, and try for as long as they can. Mr. Speaker, we should always encourage folks to strive for success. Try your best, never give up, always strive to improve, and never be afraid of making a mistake in order to better yourself or others. Never once have I heard anyone try to inspire success by admitting defeat. And for the life of me, I can't figure why this government has decided to throw in the towel on health care in this province. What books has the Minister of Health read that lead him to the conclusion that if he simply ignores the problem and stops trying, that the problem will just get better on its own? That just doesn't happen. Mr. Speaker, we are seeing letters after letter, reading complaint after complaint, coming directly from Islanders who are worried about the increasing challenges they are facing accessing primary health care in this province. The patient registry hit 16,552. Now, the other day I said 16,553. So, you know, the numbers could be off a little bit, but it's only one person. Now, I know these folks and others on the other side of the House don't want to talk about it, and I know members of the media don't believe these patient registry questions or discussions are hot topics to discuss. Well, let me tell you and tell the members of this legislature, when you talk to Islanders, it's a hot topic that don't have a doctor. But, Mr. Speaker, the 16,752 is just a number, and that's 16,752 individuals whose health care needs are not being met,
Don't forget the 3,000 Dr. Carters.
who wake up every day worrying about the challenges they may face accessing the health care system. 16,752 families who are afraid of getting sick because they don't know where to turn. It's 16,752 Islanders who have been told by this Conservative government, so long, good luck. Recently, a constituent of mine who does not have a family doctor told me she was feeling abandoned when she heard that this government was giving up on recruiting a doctor for every Islander. And that word abandoned is also stuck with me. Why does this government feel it's okay to abandon these people in need of a family doctor? Why does this government believe that some Islanders deserve better access to health care than others? Mr. Speaker, better is always possible, but only if we keep on trying to succeed. No one ever accomplished anything if they gave up after a failure or a mistake. If you're thrown off the saddle and you need to pick yourself back up and dust yourself off and get back on the horse, Mr. Speaker, and try again. Mr. Speaker, of a lot of these people that have contacted me and my caucus, they're not asking for special treatment. They're asking, where are they in the registry? Is there allotment of 2,500 per new doctor that's coming? So then if they're in the 7,500 bracket, they know 3 doctors have to come before they get a doctor. where they're not asking to go ahead of their neighbors or to go ahead of somebody that's more sick or could be not as healthy as them. They just are confused and are looking for a doctor. And believe me, I have a few health issues. I couldn't imagine not having a doctor. And, you know, I've gone from a doctor that's left to moved on to another doctor, which I was very grateful for. Some people didn't have that luxury. So all the people are asking for is, where am I on the 16,752 people on that registry? Am I 5,000? Am I 7,000? How many doctors going to take to get me a doctor? And when? And I don't think that's unreasonable at all, at all. Apparently these numbers the government are talking about are, you know, they don't seem to really resonate with them. I mean, I don't know if because we're opposition, we get more calls than they do, but I know we're getting the calls. You know, and as I mentioned, you know, many people are concerned of where they're at on the registry. You know, like, you know, there has to be plans, and you know, like, I know it's hard for government. I know it's hard. We were there, and it's not easy. But you cannot stop trying, and you have to deal with people's concerns. And like, you know, we have people that have to go off island that don't have a doctor. And they come back, and if they're lucky, they get orphaned, or they see somebody here. If they don't have a doctor, they can't get referred to a specialist sometimes. Like, this is very concerning to people that aren't well. So, Mr. Speaker, I can't say it enough that the government has to continue to work on this. You know, like, if you're going to come up with these hospital or these homes or community, medical community things, tell us how many people they're going to take off the registry in these situations, if any. And, you know, Mr. Speaker, I would just like to suggest to the Honourable Minister that when you get on the floor to legislate, when you get on the floor with your budget, take a pillow, because you could be there for a long time. And I know a previous minister that was there for 5.5 hours, and I think we're going down that road. So I just want to, you know, just a friendly reminder to be prepared. Thank you, Mr. Speaker. It's a pleasure to support this motion.
The Honourable Minister of Health and Wellness.
Well, thank you very much, Mr. Speaker. And first of all, I do not need the podium. I want to thank the honourable member from Malaria Inverness and the member from Charlottetown West Royalty for moving and seconding this motion. And I want to thank the leader of the third party for his remarks. You know, I think at the end of the day, I fully appreciate that both the official opposition and the third party, that there is a role, a very important role in our democracy to hold government to account, but they also have a role, and I do appreciate that I have had feedback from all three members that have spoke to this motion. But when I say feedback, suggestions, ways that we can improve things. So I do appreciate that, as I've had it from certain members within the official opposition as well. The member from Charlottetown West Royalty, before I get into the text of my notes here, Mr. Speaker, he used the phrase, pit in my stomach. Well, I would change it to fire in my belly. And I do have. I was honored, I was privileged when I received the call and asked if I would serve as the Minister of Health and Wellness after an extremely previous capable minister who is now the Minister of Transportation and Infrastructure. But just, Mr. Speaker, I have a fire in my belly for this, and we are going to work with Islanders. We're going to work for Islanders. We're going to try new initiatives. We're putting our money where our mouth is. Yes. Is it going to take time? Yeah. Is it going to take longer than I would like? Maybe. But we're going to get the job done. And I want to reiterate that too, Mr. Speaker, though, that I truly do want to work with both the official opposition and members of the third party. It is important. Certainly we get into question period. There's got to be difficult questions. I've fielded them pretty well everybody on this side of the House. Will we always have the answer? No. will I, as Minister of Health and Wellness, endeavor to provide answers that are honest and true. I certainly will at every opportunity. If I don't have the answer at my fingertips, and even if maybe I should have the answers upon occasion, but if I don't have them, I'll bring that information back. I'm not going to try and bluff in this situation, but I'm just going to really reiterate once more, yes, for this position, for this ministry, for Islanders, yes, I do have not a pit in my stomach, but a fire in my belly for it.
You bring a pillow.
And I won't be bringing a pillow because I'm not going to go to sleep on this job. I'm wide awake over here. I'm not sure if, the former Minister of Health from a previous administration from Larry Inverness, who I do have a great deal of respect for, I'm not sure. Maybe he did bring a pillow that day and snoozed off, and maybe he continued to snooze for an extended time period. I don't know. Maybe I should go back and look over the Hansard to see if there's any Z's going across. But anyway, Mr. Speaker, it's a privilege to stand and speak to this motion. And before I get into the details, I am going to state unequivocally, I'm in support of this motion. I will be voting for it. I will be supporting the motion. So, Mr. Speaker, every Islander requires access to primary health care, which includes access to a family doctor. And, Mr. Speaker, as we move toward a team approach, all Islanders will have a collaborative health care team to care for them. And I think that word right there, Mr. Speaker, team, is so important. Mr. Speaker, this team includes not only family doctors, but also nurse practitioners, social workers, dietitians, and the support staff for these professionals. Why, Mr. Speaker? Because the appropriate care can come from many avenues. And, Mr. Speaker, a team-based approach will provide Islanders with modern, best practice care. The team-based approach to care is called, and I know that we've heard different terminology from across the floor here in the first three speakers, but this team-based approach to care is called a medical home. And, Mr. Speaker, a medical home is a new and innovative model of primary care that is patient-centered, comprehensive, it's team-based, it's accessible, and it's focused on quality, and it's focused on safety, and, Mr. Speaker, it's focused on Islanders. And, Mr. Speaker, a medical home includes not only a family physician, but an entire team of healthcare workers that will care for Islanders assigned to the home. Mr. Speaker, this may mean that someone is assessing a family doctor through the home, if deemed appropriate. But, Mr. Speaker, it may also mean that they receive care from another healthcare worker within that team. And this is especially beneficial to individuals who may experience more than one health challenge. A one-stop primary care center can address the needs of a patient by a team, and again, that word team is so important, by a team of healthcare professions that work closely together. And, Mr. Speaker, the model will be supported by physicians, by nurse practitioners, and healthcare workers across the country as the way forward. Mr. Speaker, healthcare is continuously changing and evolving, and so are the needs of the patients, so are the needs of Islanders. And, Mr. Speaker, through recruitment, we have heard that this is a type of model the majority of physicians and healthcare providers alike want to be a part of. A team approach that can offer wraparound services to each patient. And Mr. Speaker, when it comes to new family physicians, more than 90% want to and expect to work in such a setting with such a team-based approach. Not only does it provide care, it helps promote wellness in our communities. Mr. Speaker, our platform commitment of 100 family physicians is a significant increase, and we're going to get there, Mr. Speaker. And many of these 100 family physicians will join one of these teams. In addition to these teams within a medical home, there is a medical neighborhood attached. A medical neighborhood, what is it? It's a clinical community. It's a partnership that includes additional medical and social supports. Things like hospitals, pharmacy services, long-term care, additional specialists, and other clinical providers. And Mr. Speaker, I think in that, what I just spoke of here, we've heard used the word team, but another extremely important word there is partnership. We do have to partner. We have to work together. As I said in my opening comments, partner with the official opposition, partner with the members of the third party. Hear that feedback, and I do. As minister, I do welcome that. I think that all of you across the other side realize it. And Mr. Speaker, the medical home links directly to the medical neighborhood to ensure their patients are well supported when assessing these services. And Mr. Speaker, this will help recruit more doctors as we are providing them the working environment they have asked for. We must look at new, at innovative, and creative ways to work with our healthcare professionals and partners to provide that wraparound healthcare services for Islanders, healthcare services that Islanders deserve. And Mr. Speaker, these collaborative teams provide care for Islanders in any aspect they may need by the appropriate healthcare provider. And Mr. Speaker, this may be a family physician, it may be a nurse practitioner, it may be another healthcare professional if deemed appropriate. Mr. Speaker, I would be the first to admit that yes, we have challenges. We have a growing population that is so great in so many ways, but in certain aspects, with regard to wait times, things along that line, it does create challenges. And we have to work. We have to work together. We have to do our very best. We have to do better in some areas, without a doubt, Mr. Speaker. And Mr. Speaker, I'd be the first to acknowledge that. But Mr. Speaker, with this model, every Islander will have access to a family doctor and a surrounding healthcare team. And Mr. Speaker, it was referenced earlier here, I believe it was the member from Charlottetown West Royalty. He used the term buzzwords. And when I heard that, the buzzwords, foot off the gas, throw in the towel, giving up. Well, I'll tell you, I will assure you, we're not going to take our foot off the gas. We're not throwing in the towel. We're not giving up. If you get back to the first buzzword that the member from Charlottetown West Royalty used, foot off the gas, there is another buzzword there, and it's pedal to the metal. And that's where we're going. And Mr. Speaker, I think all that you have to do is look at the initiatives that we have put in place here. You look at the last administration, their total budget for health care, and it was substantial, and I give them credit, and I give the previous administration credit for certain initiatives that they did take. But you look at what their budget for health care, massive, $710,500,000. It was, it's great. Do you know what This year's is going to be, for this administration, $846,182,000. That's a pretty substantial increase. And where's that, Mr. Speaker, where is that money going to? Yes, it's not going to be just down out the door or the window, what have you. Where is it going to? The honourable member from Charlottetown West Royalty speaks with passion, and I have the same passion with regard to our seniors, with regard to long-term care, with regard to community care. And I think that he would not dispute my passion on that for a minute. But with that, you'll look at some of the initiatives. Dementia team, $100,000. Nurse practitioner support for our nursing homes, $350,000. Dementia care bids, $350,000. Then you look at where it's really going to hit home is with regard to primary care stabilization, an additional $4.11 million for that, over and above the initiatives previously, Mr. Speaker. And these are, you know, I could go on here, but anyway, as I believe the leader of the third party had indicated, that I better be prepared for a lengthy session, because there's a number of initiatives here, and I'm looking forward to it. But with that, again, thank the mover and the seconder of the motion. I do appreciate both of your passion for health care. I've known the mover for a number of years, and yeah, we may have a few little debates here in the legislature, but we go back a fair number of years, and we, I think, have a fair bit of respect for each other, even though those debates may get a little heated occasionally. But I cannot emphasize enough, Mr. Speaker, how honored I was when I was asked by the Premier to take this position. Big shoes to fill from the previous minister, but I am honored. I do have that fire in my belly. I look forward to moving forward to new initiatives, to building upon the work that, I'll give credit where it's due, to building upon the work that was done by the previous administration, and to build upon that foundation, to move forward and to continue working collectively of all the members in here, and certainly the members on this side of the legislature, continue to work for Islanders, to do our very best for Islanders, because they deserve nothing less. So again, Mr. Speaker, just to conclude, as I had mentioned in my opening comments, I do thank the mover, the seconder for this motion, and I do support it. Thank you.
The Honourable Leader of the third party, or opposition.
Thanks, Mr. Speaker. It's a pleasure to rise and to speak in support of this motion today. And I'm not going to speak for long, Speaker, but I do want to add some sort of personal context to the reasons why I'm going to speak in support of this. I grew up in the Highlands of Scotland in a very rural place, and the family doctor, the community doctor, was just down the road. And back then, and I'm going back a few years now, of course, Mr. Speaker, the availability of that doctor for all kinds of crazy stuff was unquestioned. It was absolute. And I took a piece of jigsaw out of my nose one day, Mr. Speaker. And he fixed my sister's teeth when she came off her bike, and they both fell out. And the world has changed. You know, the expectations of the public for what they get from their doctor has changed, and the expectations of doctors of what their working life should be has changed as well. And that's the nature of life. In my own community of Crapo, well, I don't quite live in Crapo, I'm just outside, but we've had a spotty history with doctors there. There's been a doctor resident in Crapo or the area since the 1800s. And it's only very, very recently that service, that access to primary care service, has been lost in our community. And it's been quite devastating, and I've talked about this repeatedly in the House, and
I should say I'm absolutely delighted to hear that one of the medical communities is going to be centred in the South Shore region. And I think that brings me to the sort of main thing I want to say here. And it's that the motion calls for a doctor for every islander, and it describes that as a long-standing goal. And indeed, it is a very long-standing goal. And as I said when I started, I think things have changed. And I think what the motion is really saying is that every islander deserves access to excellent health care in their community. I think that's what this motion says, because we can't rely entirely on doctors to provide medical services anymore for all kinds of reasons. And the business, if I can put it that way, of providing excellent primary care to patients has expanded beyond the role of just the doctor to her assistants, to nurse practitioners, to RNs, to physiotherapists, to chronic care specialists. All sorts of people provide input when it comes to comprehensive, excellent primary health care for islanders, which I believe should be the goal of the government. So in the same way that every home has a fridge, if I can use this analogy, we don't actually want a fridge. I mean, a fridge is just this big, massive thing that gets in the way. But it's very useful because it stops your milk from going sour and it keeps your beer cold and various other things. What we want is the service of the fridge. We want all of those things that the fridge provides. Most of us have a car, but again, a car is just a few thousand pounds of glass and metal and rubber and plastic. And really what we want is transportation. We want the ability to be mobile. When we say every islander deserves a doctor, what we really are saying is everybody deserves excellent health care services. And that can be provided, again, through a number of ways. And the collaborative care model, which is being promoted by this government and which I support and have been promoting on this side of the House ever since I was elected back in 2015, is, I think, the way of the future. And if you look at many other jurisdictions which are concerned about the efficiency and the effectiveness of providing excellent primary care in a local area for the people who live there, then this collaborative model is exactly what we should be doing. So there are lots of problems when we rely entirely on doctors for the provision of medical services. We have a situation where people often have to go to walk-in clinics to a doctor they may have never seen before, and she will give them a prescription for a chronic problem, not understanding the history of that patient. They will perhaps have to go back there a month later or 3 months later, depending on the prescription and the issue, to see a different doctor and go through the whole thing again. It's incredibly frustrating for the patients. It's not efficient in terms of the delivery of healthcare services to that individual. It's not efficient for the healthcare system because a lot of time is taken up in garnering a sufficient medical history to make sure that that doctor is treating that patient appropriately. And it's not good for the finances of the province because it costs a lot of money to provide services through locum doctors and doctors who are willing to staff walk-in clinics. I see that we're at 4 o'clock, so I will adjourn debate, seconded by the member from Stratford, Mermaid. Mermaid, Stratford.
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. I move seconded by the Minister of Transportation and Infrastructure that the first order of the day be now read.
So carried.
Order number 1, consideration of the estimates in committee.
The Honourable Minister of Finance, Deputy Premier.
Thank you, Mr. Speaker. I move seconded by the Minister of Transportation and Infrastructure that this House do now dissolve itself into the Committee of the Whole House to take into consideration grant as applied to Her Majesty.
So carried. The Honourable Member from Tignish Pomeroy, Deputy Speaker, to chair the Committee of the Whole, please.
The House is now in a committee of the whole House to consider the grant of supply to Her Majesty. A request has been made to bring a stranger onto the floor. Shall it be granted?
Granted.
Honourable members, we are on the Department of Education and Lifelong Learning, page 48. Please state your name and position for Hansard.
It's Chris DeRoss, Director of Finance and Administration.
Thank you very much and welcome. Minister, do you have an opening statement or some remarks? Or do you just want to get right into the...
Let's get right into it.
We're going to get right into the
Yeah.
budget. Okay, so again, page 48, Finance and Administration. Appropriations provided for the operation of the ministers and the deputy ministers' offices and other administrative support services for the department. Administration, $115,700. Equipment, $880,000. Material supplies and services, $48,500. Professional services, $12,000. Salaries, $643,300. Travel and training, $13,400. Grants, $1,814,300. Total finance and administration, $3,527,200. Charlottetown Victoria Park.
Thank you, Chair. I'm just wondering if you could tell us the staffing makeup of this, of finance and administration.
Yeah, did you have the handout for the salaries?
Yes. What?
So there'd be 2 executive assistants, the deputy minister, a senior advisor, and a bilingual receptionist.
Charlottetown Victoria Park.
Thank you, Chair. And just one other question on this section. The equipment is up just over $200,000 there. I'm just wondering what that would be for.
Yeah, the equipment of the 880,000, actually 860,000 is various pieces of software. And the large increase is related to this fall, we're transitioning to a new database software called PowerSchool.
Charlottetown Victoria Park.
Thank you, Chair. And just out of curiosity, what is that, like a kind of an internal system? Or?
Yeah, it's replacing Trevlac and Students Achieve. So, for example, if your child's out sick, you get an email saying they're out sick. Those types of things.
Charlottetown Victoria Park.
It is very much high time that we replace that system. I'm good for that section. Thank you.
Okay, shall the section carry?
Carry.
Provincial Learning Materials Distribution Center, appropriations provided for the purchasing and distribution of learning materials for programs. Administration, $500. Material supplies and services, $797,200. Salaries, $150,500. Total Provincial Learning Materials Distribution Center, $948,200. Charlottetown Victoria Park.
Just looking at the salaries there, and I was wondering if there's a position removed. Is that just because of the timing of the budget, or was there a position removed there?
No, each year we review each section with the directors, and this particular year we looked at, took a hard look at this particular section, and there's a warehouse position that we think we can manage without.
Charlottetown Victoria Park.
Okay. And I'm just wondering, does this part of the budget have anything to do with the open education resources at post-secondary institutions, or would those be in a different section?
Those are in the post-secondary education section.
Okay.
Charlottetown Victoria Park.
I will come back. Well, if we were to consider that, has government ever considered kind of adopting that sort of open education resource into the K-12 system?
Thank you, Honourable Member. Certainly, it's something that we have considered. That being said, currently families, if they need supports, additional supports, they can reach out to the school boards, and there is opportunities to access free books and resources.
Charlottetown Victoria Park.
This would even be a potential way for government to save money too, right? Is making these textbooks available online, so not having to purchase and replace and all of that stuff. So just kind of a little something in there. And I'm just wondering, I know it's probably not this section, but I wasn't sure which section it would be under. Where would I find assessment spending?
The assessment staff are embedded in the English curriculum and French curriculum sections.
Okay. Thank you, I'm good for now, Chair.
Cornwall Meadowbank.
That's fine. Can you ask some questions, Chair?
Okay, Charlotte Section Carey. Grants to public schools. Appropriations provided for public school instructional and support staff salaries and operating grants. Administration. $2,208,400. Salaries, $238,960,600. Maintenance, $13,436,300. Transportation, $4,250,400. Program material, $2,463,500. Equipment and repairs, $1,220,600. Total grants to public schools, $262,539,800. Cornwall Meadowbank.
On your salaries, you've gone up 6 million, almost 6 million. Is there, can you give us an explanation on that?
Yeah, sure. We added 86 positions to the budget with teachers and education assistants and bus drivers and school administrative staff. We'd also have collective agreement increases.
Do you have a breakdown of how many teachers, how many
Yeah, we have 20 teachers, 33 and a half EAs, 8 bus drivers, 5.6 school administrative assistants, 4 autism consultants, 12 school counselors, an occupational health and safety officer, a transportation staff at the board level, an administrative assistant at the board level, 2 culture officers.
Cornwall Meadowbank.
So the health and safety officer, is that something new, or has that always been a part of?
We've always had one, but just over the past year with policy development, we thought we could benefit from another.
Cornwall Meadowbank.
That's fine, Chair, thank you.
Charlotte Section, Charlottetown Victoria Park.
Thank you, Chair. So I'm assuming with these new positions, particularly the teaching staff and those who kind of work directly with the children, is one of the goals of this to decrease class size?
Yeah, there'd be a portion of the 20 would be to keep pace with enrollment increases. And a portion is actually, we saw a higher than expected homeschool this year, and we think they're going to be returning to the school system, so we are planning for that.
Charlottetown Victoria Park.
Thank you, Chair. And so kind of in their decreased student-teacher ratios, then if they're kind of looking at that, that's not really going to be a goal if we're looking at potential returns. And then, so are we looking at increased supports here, or are we just kind of anticipating a return, or what's?
Well, we don't know how many will return, but it took a large increase this year, so we tried to plan for what it was the previous year.
Charlottetown Victoria Park.
Thank you, Chair. And I'm wondering about, so one of the things that we've been hearing loud and clear from different community organizations is the need to increase the diversity within our education staff, so that our young children grow up and they all have an opportunity to see themselves reflected in people working in the education system, because the seeing people kind of drives your own thoughts of maybe you could do that someday. I'm wondering if we're using any sort of diversity lens in the hiring of these new positions.
I'm not sure on that. The hiring for these positions would be at the public schools branch and the CSLF, but we can ask that question and bring that answer back.
Yeah.
Charlottetown Victoria Park.
That would be great. I would appreciate that. I know that is something that's being advocated for by different community organizations. I'm just looking at the maintenance line that's down by almost 300,000. I'm just wondering if you could.
Yeah, sure. So the maintenance decrease is tied to heating fuel and biomass. So we budget based on the average price from the previous year. And the average price for the previous year compared to the second previous year experience a decrease.
Charlottetown Victoria Park.
Okay. And the transportation line is up 360,000. Does that have anything to do with the new electric buses?
No, it's actually an offset. So our transportation line, we save approximately 33 cents a kilometer with the electric buses. So there'd be a decrease related to that. However, our schools were closed to in-person learning last April to June, which would have been reflected in our 2021 budget as a reduction. So it's reinstating that budget to reflect that this April to June we would plan to be on in-person learning.
Okay.
Charlottetown Victoria Park.
Thank you, Chair. And so just wondering about the situation with the bus drivers. I know that it was something that we heard voiced by many schools. It was a situation we heard in our education and oh my gosh, what's the name? Education Economic Growth Committee meeting. Sorry, forgot the name for a second. And so I'm just wondering how that situation is now. I know with the hiring of 8, how does that put us in line for full-time bus drivers and for kind of the substitute pool?
I think we probably need to bring that back from the public schools branch, what the current status is, but I know they have even started looking at training internally rather than through private training schools as a way to try to encourage more drivers.
Charlottetown Victoria Park.
Yeah, that's a great initiative. It's something that I know we've got a lot of issues when it comes to our bus drivers, so I can see us taking steps to remedy that, so that's appreciated. Is this where we would find the funding for the district advisory councils?
Funding for them? In what way?
Well, if they did receive funding, would it be through this?
It would be through the external relations section.
Okay.
Charlottetown Victoria Park.
I'm good for now, Chair.
Cornwall Meadowbank.
Yeah, just, you listed off the new positions. Does that, is there child psychiatrists in there somewhere, or where would I find that if that's not there?
No, there's no additional school psychologists this year. We added one last year.
Cornwall Meadowbank.
And this could be capital costs, but I know there's been a lot of questions on the 10 island schools with outdated ventilation. So does that fall under some of your equipment and repairs?
That would be in the capital budget, yeah.
So it's not in here?
No.
Cornwall Meadowbank.
Can you just give us just a quick overview of your maintenance budget as far as, you said it was more heating costs, that was a decrease by almost 300,000? What else is in there?
What makes up the entire amount?
Yeah.
There's approximately 10 items that comprise that amount. There's insurance, building repairs, school repairs under $10,000. When it exceeds $10,000, it turns into our capital budget. There's heating, fuel, electricity, water and sewer, snow removal, waste disposal, and cleaning, janitorial, shop supplies.
Cornwall Meadowbank.
That's fine, Chair, for now.
Okay. I have a question myself here. It was mentioned earlier about some of the new staffing with councillors. So when will they be in position? Not until September of this year?
Well, they've actually been added this year through the COVID contingency, but we're maintaining them into next year.
I've had a few calls from parents in my district regarding the St. Luke's Elementary School, and their counselor has been out on medical leave since November and hasn't been replaced. Is there, I'm sure you guys can find the answer as to why it hasn't been, why the counselor hasn't been replaced to date. I would appreciate you bringing that back to me. Also, if you could find out about the requirement for counselors, do they need to have a Bachelor of Education, or do they just need some kind of a certification with anything to do with mental health, counseling, or anything?
We can bring
okay,
that back.
because I know I have many people in my area who they could have an RN degree or a Bachelor of Science in Nursing degree, plus specific training in that mental health area, and they could help with counseling, and they would be employable, and I think they would be good additions to the system if that, I guess, requirement is not there for a Bachelor of Education, because the counselor should not be really be in a teaching role anyway. They should be, you know, looked up to as a friend and not as somebody that's in a teaching role. So if you could do that for me. Also, bus driver funding was bus driving was mentioned. So is there a program presently available for potential bus drivers to access to pay the $4,000 fee it is, I guess, for the training?
I think there is. I don't believe it's through our department. I think it might be economic growth, but we can bring that back as well.
Okay, and can you also find out on that program if you have to be unemployed to be eligible to access that funding, or if you could be, because I guess what I'm hearing back is some people work part-time. And these are the people that, and I know in my district, we've had people that have, you know, one who recently retired was the manager of the arena in Tignish, and he also drove a bus, and it worked well. But he was employed part-time, but if someone else wanted to take over in a similar role as a bus driver, and they work part-time, they would be ineligible for this funding for training. Is it possible to put them on, a level playing field, I guess? If you're trying to bring more in or lure more bus drivers in potentially, I would say if you could look into that and maybe ease that restriction,
We can certainly
or
look
add
into
them
that.
to it, it would be greatly appreciated.
Yeah.
Thank you. Charlottetown West Royalty.
Thank you, Chair. Although, you just kind of said it was in the capital budget, but out of those 10 schools with the ventilation issues, what would be how do you prioritize them? Have you prioritized them yet about need?
Well, we don't prioritize the capital projects at the department. It would be the two boards that do that.
Charlottetown West Royalty.
What role would the department play in that?
Funding, mostly.
So
Charlottetown West Royalty.
How much money was spent out of the COVID fund on ventilation out of the $5 million?
We'd have to look into that and bring it back.
Charlottetown West Royalty.
How would you put this as a priority if we can't wait for the capital budget to make improvements? How would the department go about getting the funding to get this started soon?
Well, our capital budget for this coming year was approved last fall, so we have our budget already approved.
Charlottetown West Royalty.
Would the department consider a special warrant if those situations are bad?
Well, we'd have to work with Treasury Board on something like that. So we can't decide that at the department.
If there's any concerns around air quality, the department will, or the PSB and the CSLF will address it immediately.
Charlottetown West Royalty.
Have you been in discussions with them about their quality?
Thanks, absolutely I have. And most certainly, again, if there's any concerns whatsoever, they do their own testing, and if there's any concerns whatsoever, it'd be brought forward and it'd be addressed.
Charlottetown West Royalty.
So obviously you've had access to their reports. Have you seen those reports, Minister?
I've been brought up to speed on them. I haven't seen them specifically, but I can certainly look into them.
Charlottetown West Royalty.
Well, then, which schools? Where are the gaps? Where are the problems? Where are the issues? And what's the priority of these schools to get some work done? After the questions I was asking you, and yeah, where is the minister on this file, and how are we going to fix this?
Thanks. They're great questions. And again, if there were any concerns in a school regarding our air quality, they would be brought forward and they would be addressed immediately.
Charlottetown West Royalty.
Because I've talked to the teachers and they said that's part of their regular schedule where they have to open the windows and these are old aging schools. So I think there is a problem looking in on the outside. So I don't understand when you say that if there is any problems. Well. There is problems. People are coming to me with those problems, and I just want to know, will the department look to accelerate funding, which is a possible thing, to look at addressing these issues?
Yeah, we can certainly bring it back.
Charlottetown West Royalty.
We talked a little bit about diversity. The department, I know you give funding to the PSB to hire people. What's your role in setting the tone for building diversity? You're the Department of Education. How do we set a tone for diversity, given the petition that we had, the discussions that we've had? just talk about that for a little bit, please.
So as we'll see in the interministerial women's secretariat, there we are hiring a position, a gender and diversity policy analyst position. In fact, I think they've already been hired. Also, we are going to hire someone specifically to ensure that diversity curriculum is a key priority. So we're in the process of making sure that that position is a full-time position dedicated to ensuring diversity in our curriculum.
Charlottetown West Royalty?
And that position will be right in the department?
Yeah.
When is that going out for, when is that open for application, and when do you think the position will be filled? Oh, they're done? No, they said that was another one.
On the gender and diversity policy analyst position has been filled. With regards to the individual who will be responsible for the curriculum development, I will have to get back to you on that, but I know there are discussions currently, and that is a priority. Yeah.
Charlottetown West Royalty?
Thank you very much, Chair.
Charlottetown Victoria Park?
Thank you, Chair. Minister, earlier, under the former minister, during COVID, he made a commitment to put a full-time counselor in every school. We didn't quite get there. But I was talking to a counselor the other day that said, Carla, being full-time means that I can actually do my preventative work, because a counselor's work's divided into like preventative and basically reactive. And counselors are spending all of their time in reactive and don't have time to do the really important preventative, early intervention, and prevention work. So she said that the difference of the 33% meant she could do preventative work, which for her and the students she works with is transformational. So I've got like a three-part question here. Are you committed to keeping at least one full-time counselor in every school beyond COVID, not just because of COVID, but because it's important? And full-time, keeping in mind that full-time means that there's actually a counselor in the school. It's not just a position that could be there, but that it's filled. So whether the counselor goes on maternity leave or whatever, there is a full-time counselor in every school. Barring the fact there could be challenges to find a counselor, do you commit to that? Do you commit to that?
So my understanding is that this is the first time in over 10 years that any counselors have been added in the budget. So what we'll do is we'll fund the 11 counseling positions, and then it'll be up to the boards as to how they determine where those counselors will go. Again, first time, and my colleague here might be able to speak more to that, but that's the first time we've actually added this many positions or any positions in the last 10 or possibly even 20 years. Is that correct?
Yeah.
Yeah.
Charlottetown Victoria Park?
My concern obviously is, our lack of, we've got kind of a perfect storm happening. We've got a lack of community organizations. We've got extreme wait times for every mental health professional. And now the student well-being teams are working at full capacity. We're adding more to their plate. Counselors are working beyond full capacity. So I'm wondering, do we keep any sort of inventory? I've talked to like 3 different counselors in the last month who have said to me that they are skeptical of government's commitment to have full-time counselors in every school because no one came and talked to them. They're working like 33% in one school. So I'm sure we know this information. Will you commit to ensuring that counselors are directly contacted and asked what percentage they're working in if they would like to work more? Because we would be able to solve a lot of problems if we spoke directly to the counselors. Not going through principals, but speaking directly to counselors would solve a lot of problems.
Absolutely. I will make sure I'll never to contact them. I'll send out an email following this, so thank you.
Charlottetown Victoria Park?
That's good.
Mermaid Stratford?
Thanks, Chair. So for the new program to train bus drivers, so that used to go through, I believe it was the sector council was doing bus driver training, ran into an issue with the training facility, which was JDI, and I think that had to do with COVID. And not being able to put as many through. So the department announced that they're now going to do training through the department. Can you tell me, has that started? And if so, how many cohorts have gone through the training?
We'd have to look into how many cohorts. I don't think it was intended to replace what was in existence, but more complemented.
Great, okay.
Mermaid Stratford?
Thank you, Chair. So do you know how many bus drivers have actually gone through that new program, though, and are now employed and driving?
We need to bring that back and contact the public schools branch to get those numbers.
Mermaid Stratford?
Thank you, Chair. And is that also, does that also cover the French language school board as well?
I'm not sure. I'd have to ask that question.
Okay.
Mermaid Stratford?
Thank you, Chair. So part of the requirement to become a school bus driver, you require grade 12 education. And that's been something that's been identified as potentially not really necessary. Have you looked into that grade 12 requirement and potentially removing it so maybe more people would have the opportunity to, because otherwise they'd have to go through for their GED in order to qualify for the training? So it's something that the department's looked at?
It's a good question. I don't know the answer. I assume it has been looked into, but we'll bring that back.
Okay.
Mermaid Stratford?
Thank you, Chair. So that was a line of question that I'd asked the former minister, and it just identifies many seniors, right, who potentially could work part-time but may not have that education level, but could have an excellent driving record. It could include farmers who have been working the land, driving heavy equipment for, not generations, but decades. So I just think it's something that we could look at in order to be able to make more people qualified to be able to do that role. Thank you, Chair. I'm great.
Any other questions? So this section carry?
Carry.
Total finance and administration, $267,015,200. Shall it carry?
Carry.
External relations and educational services. Appropriations provided for the management of external relations in the areas of federal and provincial policy, French language, Aboriginal affairs, school food program, corporate services, including research, policy and planning, statistical data and analysis, legislative development, and teacher certification. Administration, $49,300. Material supplies and services, $98,400. Professional services, $100,000. Salaries, $1,546,000. Travel and training, $9,400. Grants, $1,768,300. Total external relations and educational services, $3,571,400. Charlottetown Victoria Park.
Thank you, Chair. One of the asks from BIPOC Usher was to have 4 positions hired within the Department of Education and Lifelong Learning. And it's also a recommendation from the Truth and Reconciliation Report that there's community representation at the departmental level. And is this where I would find funding for that, for those positions, if they were?
Which position?
So they were asks for budget, during budget consultations, pre-budget consultations. There was a presentation made by BIPOC Usher to have 4 positions in the department. And then following on from that, one of the recommendations from the Truth and Reconciliation was to have Indigenous representation, community representation. So I'm wondering if those were put in.
We'd only have one additional position that we spoke about in the curriculum division that'll have a diversity lens to it.
Charlottetown Victoria Park.
Thank you, Chair. And, I'm going to advocate strongly here that this is beyond the work of one person. And this is, if we're truly committed to reconciliation, if we're truly committed to moving forward, we need to find ways to incorporate what they're asking for. And we can't assume that by putting one person in that position that we are going to move this mountain anywhere. It's just not going to happen. So I would really suggest that you take that back to the department and really look at that ask. Maybe if there's a copy of the presentation or talk to them yourselves. Also suggest that you read through that section of the report of Truth and Reconciliation, because those are really important asks, and one person that's a lot to put on one person, and I just don't think that we're going to reap the benefits from that. According to the handouts on page 9, there's increased professional services line related to the implementation of elected school boards. And I'm just wondering how much you expect that process will cost in total by the time it's complete.
It'll likely depend on the consultations and what that elected board looks like. That'll likely drive some of the costs.
Charlottetown Victoria Park.
Thank you, Chair. Do you have any thoughts on when we could expect the first school board election to be held, Minister?
We'll be receiving a report back here shortly, so I should have an update for you in the House very shortly.
Charlottetown Victoria Park.
Can you define shortly?
Yes, yes, this month, yeah.
Charlottetown Victoria Park.
Thank you, Chair. I'm just wondering how much of this process has been conducted by outside consultants in the professional services line?
We have. We had some, Volume 18 was contracted out to conduct the consultation work.
Charlottetown Victoria Park.
Thank you, Chair. We've done a lot on education governance in the last few years, and we had elected school boards not that long ago. Does the department have people internally who can do that work?
There's lots of people within the department and the boards who have gone through a lot of governance changes and certainly bring a lot of expertise to the table, but there likely will be some external contracts to help out with that as well.
Charlottetown Victoria Park.
Thank you, Chair. I think that I'm noticing a huge trend in my own work that I'm doing, and it always comes back to do we know who we have working for us? Do we know what their strengths are, what their expertise are? And I think that it's another example of what we could be doing internally. Looking at handouts again, the increase in the grants line due to the school food program, which is up to $1.7 million now. I'm just wondering if you can explain why the cost of the program is increasing.
Yeah, the majority of the program started in September, so we do have some overlap for the rest of the school year.
Charlottetown Victoria Park.
Sorry, I don't understand.
So
what
in
you
the
mean.
current year, we have September to March, but we also have April to June.
Okay.
For the following fiscal year.
Charlottetown Victoria Park.
Thank you, Chair. And I'm wondering if the program has managed to reduce its packaging or to switch to, I noticed when I was speaking to someone, they had said they needed to switch from black containers to white containers. I noticed that they've done that, but I'm wondering if there's any more work that we've done in terms of finding more environmentally friendly packaging.
Yeah, we can bring it back, but it has been an evolution. I worked, as the former Environment Minister, I worked very closely with the Department of Education. This was a priority area for me, and we have seen some significant improvements. And even just the Bring Your Own Cutlery come February, that was a real, it's been taken really well by the community, the school community, from what I understand, so.
Charlottetown Victoria Park.
Thank you, Chair. And how much is the program currently able to use local food? Percentage-wise, I think I would have to bring that back, but the focus is on local products, but in terms of percentage-wise, I would have to bring that back.
Okay. Charlottetown Victoria Park.
Thank you, Chair. And I'm just wondering how much revenue the school food program, is there a revenue we're bringing in, or is it a?
Yeah, the forecasted revenues for 2021 is $640,000.
Can you repeat that?
The forecasted revenues for the Pay What You Can in 2021 is $640,000, and we had donations of approximately $92,000 on top of that, for $732,000.
Mermaid Stratford.
Wow.
Sorry, Charlottetown Victoria Park.
That's really generous donations. Thank you for that. And so I guess that kind of eliminates my next question.
If you want, can I Do you have many questions left on this? I have a few other on the list, and I can come back to you if you don't mind.
You go ahead.
Great. Cornwall Meadowbank.
So the 732,000, does that go directly to the expenditures in the school food program?
Yeah, the amount in the budget is net.
Cornwall Meadowbank.
So is Chartwells and Cisco still playing a part in the distribution of the food? Do we know?
Not for this program, but there's many schools that have the normal cafeteria operating in conjunction with the school food program.
Cornwall Meadowbank.
And do you plan on operating it based on the numbers through the summer again?
Yes, not in our department though. Social Development and Housing is going to run the program.
Cornwall Meadowbank.
And I think your professional fees, can you just touch on what exactly those are? They seem to be on the upward trend.
In the forecast or the?
It goes from 65 to 100.
Yeah, so the current year forecast, we had $20,000 for some school board consultations.
Okay.
And we had $5,000 for a small amount of external work on the residential tenancy. And we had 2 privacy impact assessments that were completed during the year for Google Classroom, just to make sure it was appropriate to use in the classrooms, as well as the student well-being program and the data in that program.
Cornwall Meadowbank.
The Residential Tenancy Act, so you paid out of this section for part of that? Can you explain that a little bit?
Yeah, the Residential Tenancy Act is through IRAC. We provide funding through IRAC, so we incurred some costs in that regard.
Cornwall Meadowbank.
So out of the Safe Restart program, the federal funding that was contributed to the education, has all that funding been basically spent, or is it sitting somewhere, or it's not here likely?
No, it's not in our department. It's centralized in finance. It has all been spent, except many of the positions continue till the end of the school year.
Cornwall Meadowbank.
That's fine, thank you.
Mermaid Stratford.
So just to touch on the school food program, obviously an excellent program. Sounds like good uptake on it. And I know that there was a recent reshuffling of menu. So a number of parents that I've talked to are concerned about I'm going to call it, the maturity of the palate for the food, right, that is being served. So do you have a plan to kind of look at what is available through the school food program? And I know it's difficult because you're trying to entertain K to 12, so it's difficult to span that. But have you, I think there was maybe a survey or something that went out to parents, or if there hasn't been, could there be, so that parents could maybe do some contribution into whether it's working for them?
Yeah, there was a full evaluation done of the program, and certainly it has been a work in progress, and they're constantly adjusting the menu and sizes and so on and so forth. It will be a not-for-profit taking this over, and most certainly I would think that this will be a priority. It'll be ever-changing, but I'd love to share that evaluation with you if you haven't already seen it. It's quite a good read.
Okay.
Mermaid Stratford.
Thank you, I appreciate that. And I know many schools have 2 programs. So they have the original program that at ours it's the hot lunch program, but then also the school food program. One of the challenges was the milk program was offered through the hot lunch program, but it wasn't offered through the school food program, which meant a decline in milk sales, and it's just the complexity of having to go into 2 different systems. Have you looked at a consolidation between the 2? And it may have been completed, and I just haven't gone in to look.
No, I'm not aware of that. We can look into that, but I know at my son's school, he gets milk every day, but he doesn't always get the food through the school food program.
Okay.
Mermaid Stratford.
And I think it'd be a concern where they have the 2, or at least it was prior to, like if there's been any changes. So if they have the 2 programs still running, the milk program was out of 1, and it was something that that had been flagged last year during estimates as it had come through ADL, right, because of the challenge, so they had seen a decline when the school food lunch program came through. So I'm just wondering if it's been consolidated, and if it hasn't been for all schools, like, is it something that can happen? And besides that, I'm good. Thank you, Chair.
You're welcome. Charlottetown Victoria Park.
Thank you, Chair. I'm wondering, the $5 cost per meal, does this cover the cost of the meal?
It covers the cost of the meal, except the delivery charge.
Charlottetown Victoria Park.
Thank you, Chair. And I'm wondering if you could provide us with a copy of a list of the partner restaurants or companies that are currently supplying the school food.
Yeah, you can do that.
Charlottetown Victoria Park.
There's a big decrease in grants for legislative review and consultations. What's that related to? It's on page 9.
Increase. The increase from 5,000 to 50,000?
Is it, okay, yeah. Yeah, sorry.
Yeah, that's the kind of the expansion of the review of the Residential Tenancy Act and consultations.
Charlottetown Victoria Park.
Right, okay. So you may have already answered this question, and if you did, I will go back and listen, but did you already explain the $40,000 for the privacy impact assessments?
Yes, I can do it again, though. It was for Google Classroom and the kind of the data collection for the student well-being program.
Charlottetown Victoria Park.
Thank you, Chair. Would the bring your own device and internet capacity expansion be found in this section?
Which part in particular?
Well, looking at like the cost for any potential costs involved with those programs.
I'm not sure which additional costs. I know we invested in a fairly substantial firewall a few years ago, but I think it's more of an educational decision as far as bring your own device, but we can bring that back as well.
Okay.
Charlottetown Victoria Park.
Okay, I'll look at that, and then I might have further questions at some point. I do have a couple more questions, Chair, and then I'm all done.
Sure.
I'm just wondering if the department's doing anything to educate students about vaping and cannabis and the like. If you're working with anybody on those.
It's a good question. So we have a fairly strong health curriculum, and I would have to think that there would be some educational pieces within that, but I'll have to look into that.
Charlottetown Victoria Park.
Thank you, Chair. One of the things I was really excited to hear about in the most recent Board of Directors meeting is that they're currently undergoing a review of the inclusion model. And so I'm wondering if there's if that budget line would fall here.
That work is happening at the Public Schools branch. I'm not sure which budget in particular, though. The budget necessity will probably come at the end of the review when all the additional investments are identified.
Charlottetown Victoria Park.
But would they need money to conduct the review? No?
Well, there's a joint committee between the department, CSLF, and also the Teachers Federation. So, I mean, they're just our staff. There'd be no additional cost at this point.
Charlottetown Victoria Park.
Thank you, Chair. So also the review being conducted on kindergarten. Where are we with that? Is that, maybe that doesn't fall under this section either?
In terms of additional costs of the review, so there wouldn't be any additional costs to the review currently, so it'd be current staff that are responsible for those consultations.
Charlottetown Victoria Park.
And I'm wondering, Minister, if you would be able to give us updates on both of those reviews, how they're going.
Sorry, can you?
The kindergarten review and the inclusion model review.
I can certainly bring that back.
Charlottetown
Thank you,
Victoria
Chair.
Park.
I'm good for now.
Leader of the third. Party.
Thank you. Can I just go back to the food program? Could you give us a little history on how these contracts were awarded, how was it set up? Like, did you have to have a certain amount of staff, or did business have to be a certain size to accommodate schools to do the lunch programs? Like,
no.
were they selected? Like,
Yeah.
I didn't see anything in the newspaper where there was a tender for people to apply or a restaurateur to apply, so could you give us a little history how that was awarded?
Yeah, I'm not sure on the dates, but there was a request for proposal that was issued. And I believe that every vendor that put a submission in received some schools, depended on their capacity as well.
So
Leader of the
was it
third
in
party?
media then? It was in the newspapers and,
It may have been on the provincial website. I'm not sure about the newspapers. It definitely would have been on the provincial website, though.
Leader of the third party?
oh, that's good for now, thanks.
Mermaid Stratford.
Thank you, Chair. So I need a little more explanation on the IRAC spending in this area when there is a whole section dedicated to IRAC, and there's an appropriation. Last year it was 1.4, this year it's 1.6. So what is it, wouldn't the Residential Tenancy Act be under that section? And I'm not understanding why it's under this current section.
Well, we fund IRAC, so we're the link to IRAC
Yeah.
through government, but the expenses will be incurred in our department. So that's why it's in our budget.
Mermaid Stratford.
Thank you, Chair. Which I understand, but there's a whole section, and it's on page 56 of the budget, though, that is IRAC. So it's an appropriation that goes to IRAC. So is those kinds of consultations not funded out of that section for IRAC?
If we were sending the money to IRAC and they were engaging in the consultation, that would be more appropriate, but we're actually the one engaging the consultant to do the consultation.
Mermaid Stratford.
Thank you, Chair. So the Department of Education is doing the consultation on the Tenancy Act?
It is being moved to social development and housing. So they'll be proceeding with the consultation on it. For the next draft.
Mermaid Stratford.
All right, so it's thank you, Chair. So it's the policy and planning portion of this department that's covering that consultation, which presumably when do you expect to have that moved? So if it's in this, does the appropriation go with it?
Yeah, the budget was set prior to that decision being made. So essentially, social development will perform the consultation and invoice us for the cost.
Okay.
Mermaid Stratford.
That clears it up a lot for me. Thank you, Chair.
Leader of the third party.
Thanks. So IRAC falls under your department, is that correct?
It's the final section, yeah.
So what responsibility does IRAC have to you? You fund them, and they give you an annual report. You have no decision-making in any of their decisions. You just take their report at the end of the year. What's in that report that you get back from them? Is that their decisions that they've made, or land issues and things like that, or?
Well, it's likely available online, or if not, we can get you a copy of it.
I'm sure
Leader of the third party.
Just like the House to hear, like, what's all in that report that you get from IRAC? Like, is it all their dealings for the year?
I don't have it with me, but certainly their audited financial statements will be included.
So it's financial, it's not decision-making?
I'm not sure, we'd have to bring it back to go through.
So the minister
Leader of the third party.
The minister has no say at IRAC. I think like it's a separate identity. Okay, thank you for now.
Shall the section carry?
Right.
English, French as an additional language. Appropriations provided for the delivery of English, French as an additional language programs within the public education system. Administration, $11,000. Equipment, $10,000. Material supplies and services, $30,000. Professional services, $76,000. Salaries, $458,500. Travel and training, $8,000. Total English, French as an additional language, $593,500. Charlottetown Victoria Park.
Thank you, Chair. I was very happy to see the funding for PEI Literacy Alliance. That was one of our asks in 2020. And I'm wondering if this is a guaranteed ask for them every year, or sorry, something that is guaranteed for them, or do they have to ask every year?
I think that's the following section, but we did do a 3-year contract with the PEI Literacy Alliance this year. so it ends in 2023.
Charlottetown Victoria Park.
So sorry, that's in the next section?
Yeah.
Okay.
Charlottetown Victoria Park.
I'm going to let you move on for now, Chair. I need to find myself.
Are there any other questions in the section?
Yeah.
I hear somebody, I'm sorry, Charlottetown Winslow.
Just in equipment there, under 10,000, what's the new equipment?
Software is actually grouped under equipment, and it's a new database software for our international students.
Okay.
Charlottetown Winslow.
No, that's good, thank you.
Okay. Charlottetown Victoria Park.
Thank you, Chair. I'm just wondering how many EAL teachers we have this year compared to what we had, or are we up or down EAL teachers this year?
We would be the same.
Charlottetown Victoria Park.
Was there any change at all since COVID hit?
Yeah, I think the one change is during COVID at the public schools branch. I think I'd have to get the number, but some of the itinerants were reallocated to the front lines.
Charlottetown Victoria Park.
Thank you, Chair. And when you say front lines, what sort of positions would that be?
Like classroom teachers.
Charlottetown Victoria Park.
Okay. That was a huge concern that I had heard. And Minister, I'll throw this over to you. One of the big concerns that I heard from a couple of different people was who are EAL teachers is that they were put into other positions and they were done so in a way they were told, okay, they were accommodated for what they were educated in. And when push came to shove, there was one teacher who was teaching, instead of kind of having like a balanced schedule, he was teaching like junior high science, different things all day. And he's an EAL teacher. And there was a lot of concern that came from the community as well as the EAL teachers because you can't take away that service. That is a crucial service. Or not, if we look at the amount of newcomers we have who need that additional language, because then who does it fall to but the classroom teacher? And that's not. I mean, teachers do it because that's what they do. And I've told the story before about the teacher going home and making rings for her students so that they could point to a toilet if they needed to go to the bathroom. We cannot take any extra support teachers, extra support people out to support the front lines because they're there for a reason and they're needed. And I think that is something that you need to think about really, really clearly before you start moving people out of positions. They're not just, they're not there because they're pretty. They're there because they do an important job every day. And so I would like to see a commitment that you would not consider moving EAL teachers out of their positions or anyone out of their positions. They're there for a reason.
So when we were working through the pandemic and the return to school plans, there were positions reallocated from a number of different sections. EAL was one of them. There was curriculum was another, as well as coaches. It was really all hands on deck to try to make it a successful return to the school, in-person learning. But all of those positions have returned to their appropriate sections for the coming school year.
Charlottetown Victoria Park.
Thank you, Chair. Good.
Okay.
Yeah, thank you.
Mermaid Stratford.
Thank you, Chair. So a little jumping because I don't know where this sits, but the Record Information Management System, so the RIM strategy, that resides within your department. I don't know where it sits or if it's in library or is it under library?
There's a section that's coming for that.
Okay.
Mermaid Stratford.
So that's good. And oh darn. Oh, thank you. So the International Student Program, that was a program that was recently audited through the Auditor General. Whereabouts, would that sit in under this section or is that program somewhere else?
No, that's in this section.
Okay. So that audit came back with a significant number of concerns and recommendations. Is there have you embarked on a process of how you're going to address that?
Yeah, thanks for the question. I actually got an update on all the recommendations today with regards to where we stand on them. So that's something I can share with you, or if you want me to go line by line by now. But no, I have been received, and there's significant progress being made on the insurance component, the homestays, the agents. So, okay.
Mermaid Stratford?
Thank you, Chair. So is there appropriations for any additional measures that you need to take in order, I know you'll have to get it up to a standard, but then there would be, I'm assuming, inspections and that kind of thing required. Is there any additional appropriations that you foresee is going to be required in order to get that program better, I guess, up to a standard that, to meet the recommendations?
No, we don't foresee any additional costs. For example, we did an RFP for kind of a standardized insurance package for the students, but it's the students that purchase from the vendor. So we did an RFP and found kind of the best package, but then we're not in the transaction, so to speak. And same for the homestay. We're currently evaluating an RFP for homestay. And what that'll generate is a preferred homestay provider. But again, it's still the student that engages with the homestay vendor.
Mermaid Stratford?
Thanks, Chair. So my understanding, though, is that they would have a representative. So is it the representative that engages with the homestay, or do they come here through someone else, like study abroad or another program of that nature?
Yeah, the some come through agents and some come directly themselves.
Mermaid Stratford?
Thank you, Chair. And that final question. So the RFP that you have just put out, how is that engaging with the agents, and whether they're, I'm not sure what you're fulfilling there for that package?
Well, the RFP process looked at the various vendors for homestay and is going to choose one that is guaranteed to meet the criteria for that student, and then the agent will be directed to use that one. And if they don't want to use it, there's probably going to be some sort of waiver or something of that nature. We can't force students to stay at a certain location, but we can say that we have a contract with this homestay provider, and we're telling you that they're a good one.
Mermaid Stratford? The hour has been called.
Oh my gosh, where'd that time go? Sorry, you don't feel the same, do you?
Do this one, Mr. Chair. Okay. Mr. Chair, I move that the Speaker take the chair and that the chair report progress and beg leave to sit again.
Shall carry? Carry.
It's warm in here.
Mr. Speaker, as Chair of the Committee of the Whole House, having under consideration the grant of supply to Her Majesty, I beg leave to report that the committee has made some progress and begs leave to sit again. I move the report of the committee be adopted.
Shall carry. Honourable members from Morel, Donna, and the Government House Leader.
Thank you, Mr. Speaker. Mr. Speaker, I move this House adjourn, seconded by the member from Charlottetown Winslow, that this House adjourn until April 8th at 1 o'clock in the p.m.
Shall carry. Have a good evening.